Oh, what's cool? This is I think episode 7, right? Which is apparently like,
Ooh, 7.
Yeah, like most. I guess the average podcast
lifespan
is like 7.
Well, we got plenty of ideas here going, so we're just getting started.
Yeah. So I've got this is a crazy weekend for me. I've got this tonight. Tomorrow afternoon and evening, I've got photo shoot at Barrel House Z in Weymouth. They've got like 3 rescues coming, a whole bunch of dog vendors. I'm doing the photography. That's for like 5 hours. And then Sunday, I've got in Laconia, New Hampshire, the World Championship Sled Dog Derby.
That's going to be exciting.
So that's like, I don't know, the big leagues is what it sounds like. So
it sounds like it could be cold laying out in
yeah,
the snow.
I actually just bought boots and like winter, like, I don't know they're called bibs. They look like pants. They got like overall suspenders. I'm gonna look like a lumberjack, but
oh my goodness, sounds like what firefighters wear.
Yeah, pretty much that. Yeah, so that I can just lay in the snow in peace. Which one? I'm trying to think if I want to start with death or consciousness first. I guess let's go with what do you think consciousness is? I know that's like a question that you
hard,
can't answer, but there's no answer to it. I'm curious, just because I like the way you think, and so I'm just kind of curious on
what I think about it.
So like, because one thing I kind of like, so we don't know exactly what it is, where it comes from, whatever. Right? There's a million questions, yet somehow we've been able to master it with like anesthesia, which is like kind of crazy. Yeah. Where we call
it depths of anesthesia, where we can like figure out what level of anesthesia a pet needs to be for, basic, like just something quick and easy versus something that needs to be under anesthesia for like spay, neuter, dental, and then like obviously last anesthesia.
Yeah. But it's just wild that we can like turn it on and off, but we don't know what it is.
Yeah.
I guess.
Yeah. Just.
What do you think it is?
Well, I think consciousness is a little bit different than depths of anesthesia, because they're practically asleep anesthetically, so they're not like at a plane where, I don't know if you've ever gone to anesthesia where you just go to sleep and then you wake up and you don't remember anything. That's kind of like the depth they're going at versus consciousness. I can't say words,
Consciousness.
There you go. Where I still think we can like grasp and like process thoughts, almost like dreams, almost is how I view consciousness. Like you can grasp thoughts, you can grasp reality almost, but I think it's different than anesthetic death, where you go in and you wake up a couple hours later, no clue how it happened. They tell you to count down and that's the last thing you remember, type thing.
I remember that very vividly. I had eye surgery once. It was the most pain I've ever had in my life.
What happened to your eye? I just gotta know.
So kind of a wild story. So back in like high school and college, I was big into BMX, like the little
the bikes,
trick bikes, So one day, I remember going up a ramp, and then I remember like getting up off the ground. I don't really remember much in between. I don't know how long it was, but I'm pretty sure I broke my back. I gotta have to like Google the back condition, but I messed my back up. Oh, of course, my phone's not on silent. Let me put that on silent real quick, because I'll get a phone call.
Spondylosis.
Yeah, spondylolisthesis, a spinal disorder in which a bone vertebra slips forward onto the bone below it. So like my I don't know, the last vertebrae before my hips is like pushed forward a couple millimeters, and I have like a herniated disc.
Oh.
I hit the back of my head, and I had immediately like a bunch of like, you could see like blood, like.
That's not awesome.
Yeah. No helmet, of course. I wear helmets since then.
I always think we're invincible until we're not. So
yeah, and the weird thing with my eye was my vision, everything was fine. It wasn't until a year later that I finally went to a doctor. After this, I didn't go even that. I got up and we just kept riding bikes. Like it was just another. I was real stupid back then. Yeah. So he's, the doctor's like, "You're lucky you didn't die."
Yeah.
We did an MRI.
Bob Saget.
Yeah. Oh, is that what happened?
That's what someone was saying today. I mean, I don't know, rumors.
Brain aneurysm?
That he got hit in the back of the head, and that's why.
Oh, he just bled?
Yeah. Internally. I mean, you don't feel it when it's inside your skull until it's pressure and it's too late.
Right. Yeah.
You're out.
So a year later, I finally went to the doctor. The reason is because, so I was at college, I was like sitting in the back, not a huge classroom, but the blackboard, I'm like, I can't see shit. Even with my glasses on, I'm like, everything is weird. But if I blocked one eyeball, I could see fine. It didn't matter which eyeball I blocked. Right? So it's like, okay, what the fuck? Oh, sorry. I'm already drunk off 3 sips. And so I was like, that's really weird. So I started playing with blocking my eyes. I noticed there was like this almost lag. So like if I focused on like the tip of your wine bottle and covered one eye and this eye's looking at it, when I'd cover my other eye, when I do that, it's a pretty seamless. But what was happening is this eye was looking over there. It was completely crossed and kicked in. And so you could see there was like a literal delay, and you could see my eye move over to like right itself. And so I had double vision. So anytime I was looking, I was seeing double. It was brutal. So they had to, I think they sliced through on either. Why are you squirming?
People stuff is so gross.
Either side of like, the retina.
Yeah.
Is the white of the eye, I assume eyes are similar to dogs. Is that kind of like.
The iris? No, that's not.
Well, the middle is important.
Sclera.
But like the like outside, you can just go right through, I think. Because I think they just they went in and they trimmed the muscle. Basically the two muscles that control one stretched and one was real tight. So they had to open it up and loosen the other. I think this was forever ago. They took a bit of the muscle from this one and put it in here, stitched it all back up. 45 minutes in and out. But I don't remember. I remember them counting down, and then it's almost like a literal movie scene transition. Yeah. Where it's just, I'm just like, like just scream because it hurt just really bad. My mom actually had the same surgery. She can attest that it is brutal. So
I bet.
diplopia, I think, is the name of double vision. But yeah, so that's my experience with anesthesia. I've had a few other surgeries, but that was like the big one. But yeah, I mean, just there's no fight in it.
No, you just you're out.
It was
and
like I said, what's weird with that though, I feel, is like with dreams and like sleep, I feel like I can feel the time passing.
Yeah, I think I get that.
But like with anesthesia, like I said, it literally felt like a jump cut. It was just like whoa.
Yeah, and I'm assuming it's similar for animals too. Absolutely
crazy, yeah. So,
but they get pre-med and we don't get pre-med, so.
So what is death? Death, I think, used to be, I'm not a doctor. You're not a doctor, but you're more of a doctor than me. Death. All right, if your heart stopped beating, right, they used to consider you dead. But like you can bring a dog back. So like heart beats not death? Is it a cumulative? Like, what,
I think it's
is
a
it brain?
cumulative. It's brain, heart, nervous system.
What is that?
Organs, everything combined. Mainly being, I think, death is, the brain and the nervous system. I think which shuts down after your heart, because I don't know, some euthanasia's pets tend to have a muscle spasm at the end, and we always warn people before. I'm like, it's just the neurons in the brain firing off the last few signals. So they may twitch, they may stretch, they may yawn. Like, it's just like the last. But I think
do you think the brain trying to not save itself, but like keep stimulation?
I think it's stimulation, and it's releasing the final stimulation. Like, it's just giving its last kick of the bucket. Let's say that. And then, you
could almost think of the brain having its own heartbeat, and that's it. Like,
exactly. Usually the heart will stop before the brain. I don't know, every animal is different, but, they're pronounced dead when their heart stops, but it usually is like within a minute or two.
Okay. So I guess, what exactly is the procedure like?
So
if you could go start to finish, just because, instead of starting at the end, let's, start at the beginning.
Well, euthanasia, what to expect is, obviously the doctor will go over it with you individually in the room, because some doctors do different procedures for euthanasia and their own protocols, and different hospitals have their own euthanasia protocols.
You have to be an anesthesiologist to administer in the pet world?
No, but only veterinarians can administer euthazol. It's
is that the name of the
there's euthazol. Fatal Plus is another one. It's a couple.
They're real.
I know. It's weird to think that there's different brands of euthanasia solutions. So
that name, they're just right.
Yeah.
Is that a liquid?
It is a liquid. Yep. So what to expect is normally in normal euthanasia situations, not every situation's similar, because emergency versus preparedness of euthanasia. So like, say, straightforward, standard, old pet, quality of life poor,
or like a car hit my dog.
That's like a more of an emergency type. And if that's, we'll discuss that later too. So I have a whole what we typically do for the standard process, we'll go over the process, what to expect. If they've never experienced euthanasia before, we go over, what we're going to do so the owner's prepared. Usually, while the owner goes, and they typically pay before, depends on the hospital again. So that way you don't have to wait in line after and stuff. So we'll send them out to go check out, choose their options for burials versus cremation versus other. And we'll go in and give a premed. So there's a bunch of different premeds. So telazol, ketamine.
I know that one. not from personal use, guys. Chill.
Yeah. Domator, which is dexdomator. Each one has different effects. All is anesthetic depth. So each of those will cause the pet to fall asleep. So the owner will go pay. They'll come in, we'll give the injection. While they're paying, we'll put a catheter in, so that way they don't have to witness that.
Sorry to interrupt you.
Yeah.
Sue and I, Sue's going to thank me because we're both in the same boat here. We're both very confused about that term. Is that shorthand for just IV?
Yeah, so it's an IV catheter, so it gives you direct line access to the vein.
Okay.
Yeah, so we'll shave a little spot, put the catheter in.
Because, sorry.
It's okay.
The only time I've ever heard that word is any time I've heard of...
a urinary catheter? Yeah. No, this is a different type of catheter.
Okay. So That's just shorthand. Okay,
Yeah, so a urinary catheter gives you direct
clear that
access
up.
of the bladder, and then IV catheter gives you clear access of an IV vein.
Right, perfect.
Intravenous is what IV means, but
Okay.
so we may, depending on the pet, if it's anxious, may give it a little sedative beforehand, but the owner is obviously aware and prepared. And then if it's not anxious, we can usually just get a catheter in. Then they go back into the room. Everyone.
And what's the catheter giving them at this point? The
access to the veins. So when we give the meds,
Oh, so okay.
Yeah. So we'll give them the sedative.
So that's just sort of like hanging.
No, it's we have it taped.
Okay, or tape, but like
taped.
It's just sort of like it's plugged into them, but nothing's plugged into it yet.
Exactly. I mean, it has a plug at the end that you insert a needle into, and it's taped down,
It's
and
basically
then
a funnel into the vein. Yeah.
exactly. Some catheters will have extension lines, so we can give the owner a little bit more space. We don't have to be like up in its face. Just depends on the hospital and what they have for catheters. So like I said, we give them a premed. Like I said, usually Tylenol, ketamine, Dex, and that will cause anesthetic depth. I don't want to death and depth. Depth.
DEPTH.
Exactly. Each one of those has their own properties. Tylenol being very strong for causing anesthetic depth, and then
what exactly does that mean?
So they're falling asleep, and it's a very deep one, so it's not easily awoken or stimulated out of that depth.
I think I've heard of rapid eye movement sleep, REM sleep, like that. Yeah, that's that super deep sleep. Okay.
Yeah. They're like cousins, I would say, maybe, because one's medical, chemical, and the other is, natural sometimes. Ketamine is another one.
Okay, so they're not getting up from that.
No, typically not, unless you wait longer than the body wears it off. Each one's a little different.
Just mentally shutting them off.
So yeah, it's
right.
like
because you said they can still kind of have spasms.
Yeah, so depending on the Euthazol too, I'll go over that in a bit, but it has different properties that help prevent that. The pre-med is just mainly to have them go to sleep. We warn people that, their eyes don't always close. That's very common. So typically everyone's like, oh, can you close their eyes? I'm like, you literally can't.
Yeah, not yet.
Nope. Even afterwards, it's just, it's just something that the body does. You can't, we'll try to close them and they won't stay closed. And I'm like, sorry. And then, as I mentioned, ketamine, another really good anesthetic depth, and also has pain relief qualities to it. So if it's an older pet that seems to be more painful, ketamine's a good option. It's usually more restricted, so not a lot of hospitals use it because it's a abuse drug type.
Yeah, I can imagine like liability there.
Yeah, there's a lot of paperwork
ketamine,
and everything's locked up like 3 times over, but there's just a lot of paperwork and stuff for that. And then Dex is also a good pre-med sleep and pain relief qualities. But I think the most common I see is, at my hospital at least, is Tylenol, because we don't see a lot of pets coming in for, painful reasons.
So is I know at this point your pet is not dead.
No.
But essentially that's goodbye right there.
No. So that, like I said, the body will process that and it will wear off over time. So if you give the body time, the pet could wake back up.
Okay. Or what I mean is, because obviously you're going to follow through now with the euthanasia. So like essentially though, like that's the last time you can like, get your kisses, get your...
Yeah, because they're not going to be awake.
On,
yeah.
It's that... Okay.
Yeah, because they're asleep at that point. They're not feeling much. And then...
I'm just thinking of the future. This is killing
don't think about it now. That's why you can't think about it now.
As we talk about it for 2 hours.
I know. After this, we'll forget about it. Drink more. And then they push, the doctor warns you beforehand, obviously, that they're going to give the euthazole. We usually give owners time until they're ready to be like, okay, we're ready. We'll ask them how much time they want, and we'll come and check in the tech and ask if they're still ready or if they need more time. Because obviously it's not a rushed process. It never should be rushed. You should never feel rushed unless it's like an emergency situation where your pet's suffering type of thing.
Just like absolute misery.
Yeah. And then the doctor will come in usually without a tech, because it's like a, just last minute, more people in the room, just feel, you don't want to make the owner feel uncomfortable. And
do you ever feel uncomfortable?
No. I feel at this point I'm very comfortable with it. I feel I'm very good at giving my condolences. For euthanasia, the thing is, you yourself can't be emotional. You can't be crying in front of the owner because they're already they're already
train wreck, right?
Yeah, they need someone to be strong in the room with them, so that way afterwards you can kind of support them mentally and help them leave the room. And
do even the men who have cried twice in their entire life, do they cry on that day?
Yeah, I find a lot of guys cry, and I feel it gets me more than women because we tend to be a little bit more emotional. So seeing like a ruffled, gruff guy crying over his tiny little chihuahua, it gets you. But again, you gotta be strong. You can't be crying. You can't be emotional. You gotta be strong for the pet and the owner. The euthazole or Fatal Plus, depending on what the doctors use. It uses a pentobarbital, which is the active ingredient. And then I can never pronounce it. It's the other active ingredient. But the phenobarbital slows the brain and the nervous system down. And then the phenytoin, I can't say it. Let's just say that.
I'll Google it and I'll put the word.
Yeah. It's
right here.
It's an anticonvulsant. So, like I said, a lot of times you won't see that muscle spasm because of the anticonvulsant in it.
And this you're talking is in the actual anesthetic, not the
No, it's in
premed?
Yeah, it's in the actual euthanasia solution. So it's kind of they're the two active ingredients, and you're pretty much just overdosing them on that. And that shuts down the body.
That goes into the IV
catheter.
Yep. Through.
Yep. And then we give a flush to flush it through. And then it's usually within 15 to 60 seconds that a pet will pass. So it's really quick.
So it's just bloodstream right to the brain?
Right through the heart, and the heart pumps it through the rest of the body. So it's very fast. It's very quick. It's painless. Like I said, the muscle spasms, and sometimes they even make noise because it's the muscle spasm in the throat, and the lungs are getting compressed, and so the air is getting pushed out, and they may make a little noise, but they don't feel it because of all the premeds and the euthazole, and they don't feel anything unless stuff was improperly given. And the only reason like a doctor should get more euthazole is typically if the pet already has bad cardiac deficiencies or circulatory deficiencies, and it's just taking a little longer because of the circulatory system not pushing that through the body. Usually they'll get a little more and give it too. That doesn't mean your pet's like feeling stuff. It just means that the pet has bad circulatory issues, and that's usually very frail old animals or
What's
pets.
a regular dose of this medicine?
So it's by weight.
Okay.
I think it's a mil per 10 pounds or something like that.
So it's not like this a crazy amount of...
No, though a 100-pound dog can get 10 mils. Usually doctors will go over that just to be safe. So a 100-pound dog, they may give like 15.
This would kill a human?
Oh, yeah. That's what they use for...
prisoners?
Prisoners. They use propofol, which is the magic milk to put you to sleep. And they push the barbitals and all the fun stuff to make you feel that. So they're getting a painless euthanasia as well.
Yeah, they're treated like animals right up until death. I see. It's true.
Yeah, so pretty much the same.
I do personally, real quick, political take. I do feel bad for a lot of prisoners. Those conditions are. I watch a lot of prison stuff, and the conditions. Oof. I mean,
I don't think I have an opinion about it right now, just because I don't know much about it. I like to know things before I make it. Yeah, obviously. I think obviously petty things like marijuana and stuff should be forgiven for the people who are in jail for a very long time because of it. But
that's one of those things are crazy.
it's just crazy to think about. Like the crimes now are very different than then, and the punishment and stuff like that. But I don't have very much knowledge about it, so I can't make an informed decision on how I feel about our prison system. Yeah.
But they're not treated great, and it's just interesting that, you know, because that's the, you know, a lot of times it's like, oh, we're treated like animals, and it's just funny that, like, oh, the same thing we put our animals down with, they're putting, it's just, that's just interesting.
Yeah. Well, we want it painless, hopefully.
Yeah, no. I mean, it's not a bad thing.
Yeah.
It's better than the electric chair. Like, let's be real.
Getting fried. Oh my God. I think that's
Can
barbaric.
You imagine? Holy crap.
We don't even do that for animals, so.
Yeah, thank God.
Yeah.
It's like literal punishment. I feel like that's more punishment than and retribution, or like vengeance than.
I mean, I guess I would get it for like the really bad crimes like rape and murder and stuff like that. But pedophilia, ugh. Yeah. People are gross. People are fucked up and gross. Yeah. This is why I like animals.
Yeah, animals. They're great. All right, so that's going through the body.
Yeah, so that's just like the process. Obviously, your diet
that's just crazy how quick.
It's really quick.
And small, like, that's wild.
Yeah. It's quick, painless, and obviously your doctor will go over that with you more thoroughly than my brief synopsis of this. What to expect, what to be prepared for, type of stuff. And you sign stuff that you understand that too, because there's crazy people out there, you know, like, you killed my pet. And I'm like, you brought it in for euthanasia.
Yeah, that's the point.
Some people just aren't ready to let go, and they're like, okay, we're ready, and then they change their mind after the meds are
in and out, in and out.
Yeah. I'm like, we've already pushed the euthazol, your pet is dead. Yeah. And I do feel for them because, again, you know, it's very emotional and stressful, and you just gotta be, again, strong for the owner.
Have you ever heard of group
cremation
or like group euthanasia? Someone was telling me about the other day where, like, it'll be like a group of people with like dogs that all get together and like have them. Have you heard? Okay.
No.
Okay. No. I forget who was telling me about this. But I was like, what the heck? Who would want to do that?
No, that's just
I want it private. Like.
Yeah. There's group cremation where your pet's euthanized and all the ashes go together with other people's pets.
Yeah, and you might not get
You don't get your
you
pick that.
Okay, yeah.
Some people don't want the ashes back. They don't want the the constant reminder, especially if the pet like went downhill fast and or it was a long and painful journey to get to that decision. Okay. Some people don't want that. They just want like the collar or a paw print. They don't want the ashes. Which is understandable. That's totally fine.
Why do it with a group, though? Can't you just do the cremation and not keep the ashes?
Well, so you don't go with a group of people.
Okay.
So you go in privately for a euthanasia.
For some reason, I thought it was like...
I had to think about that for a second. I was like, what? Yeah. No, you go in and do it privately, and then your pet is sent to the crematory, where then it's...
Maybe this person was like a super hippie into some real weird...
Yeah.
From my understanding, they're telling me like 5 different families with 5 different pets would come together and like.
Oh my God, I don't think I've ever heard that in my life.
That sounds like the most barbaric thing ever. I want like me and like I don't know. I wouldn't want. Is it usually just the immediate family?
Yeah, usually like the household members of the
kids.
Sometimes.
Is that touchy?
So I think some parents want them to understand, and that's totally fine. I think they should understand that, the pet's not coming back. They don't have to be there for the actual thing, but I think they should get their chance to say goodbye rather than the parent take the pet, to the vet and then it just doesn't come back. And they're like, oh, they're at a farm.
Right, yeah.
Or they're up in heaven.
Classic excuse. The farm.
Looking over you, and they didn't get a chance to really say goodbye type thing, But some people some owners are very realistic and want their children to be realistic about the situation, and that is okay. We allow people to be present or not be present. That's, up to them. I do believe personally that the owner should be present at least until the premed. They don't have to be present for the actual push of the euthanasia. That euthazol, that's totally fine, but I think they should be present for the sedation, the premed sedation, because you don't want your pet's last memories to be frantically looking for you with strangers around them and it has no idea what's going on. I would think, personally, and again, I would push this for a lot of people, they don't know what's happening, and I think you should support your pet. You got the pet into the very end, even if it's just until the pre-med where it falls asleep with those memories.
Yeah, a lot of pets, I feel, don't like the vets. It's like this traumatic.
It's very traumatic. So it's very scary.
Like, you want their last moment to be filled with.
We're putting a catheter in, and that's kind of ouchy. And, some, doctors just don't even do catheters. They just do like a butterfly line, which is just like extended line to the vein. That's old school, which is totally fine. But they usually pre-med beforehand. That's just a different way. I just forgot to mention that. But I think you should be present at least until the pre-med, and then, that way the pet's last memories isn't fear, And that's why I think I feel so bad when the owners leave and the animal's desperately looking for them and, they don't understand what's happening. And
do you think consciousness is tied to, do you believe in like a soul or anything?
I do. I think we do have souls, spirits. I don't know what's beyond that. I told you I'm not really religious because it's just the science. I'd like to believe there's something.
I used to be as a teenager because I was like always getting bullied. I had to be edgy, so I was always like, religion. Yeah. But I swear, as I've gotten older,
I think I'm more spiritual. Like I'd like to believe in those things, but just the science behind. There's no science behind it backing it. I don't believe in one specific religion. Mm-hmm. I believe we all believe there's something out there. Hopefully.
Yeah. Yeah. I'm very hopeful. Like I used to be adamant, like, no, once you're dead, that's it. Like,
and I think that's a big fear. Is that you're dead and you just don't exist. There's nothing. I think that's like a big fear for a lot of people. We can't even
literally imagine nothing. Exactly. A lot of people imagine just like black. No, nothing is nothing. It's like
it's nothing. Like you just don't exist. Yeah. And I would really love for that not to happen, but
exactly, yeah. So I'm hopeful, and I used to be adamant that like no, blah blah blah. But now, as I've gotten older, sort of like
I hope it's a rainbow bridge and all my animals that I've ever had, my dogs. I want them to be there. Like I want something.
Exactly, yeah.
I'm hopeful,
And so you think, so yeah, if that's something that transcends us, do you think other animals, yeah?
I think it depends on the intelligence of the species, honestly. Because, I mean, they are dogs. We always anthropomorphize. There we go. I don't know if words here. Animals, and they don't feel the things that we feel the same way we feel them. Like we talked about last time, they don't think of the future. They think of the present and the past. They're like, oh, that person abused me type of thing. Oh, men are scary. Oh, this is my favorite person. Here they are. They don't think about when they're going to see them next type of thing. So I think they feel things.
Set up lunch dates like
exactly. We do, They don't anticipate the way we do. And I think they just don't understand like the level that we do. I would like to think that maybe.
Which is interesting. So essentially intelligence can be maybe separate from the soul.
Exactly. I think that's a really good way to say that. Yeah.
You know?
Yeah. I hope, souls, carry over what you were and, the memory of what you are and what, your life. But I don't think intelligence wise it carries over to that. But who knows? We don't know.
Yeah, I know.
We'll never know.
There's literally no knowing. Yeah.
Unless there's some freaky deaky science that figures that out.
Yeah.
Yes. So that was a lot of stuff.
Yeah.
There's a lot to consider, when deciding to have your pet humanely euthanized. I'll emphasize humanely. Obviously, letting your pet suffer is not humane. Or going outside the ethics of euthanasia, there are laws on how you can euthanize an animal. And it's usually via vet or medical professional. Do you at home yourself euthanizing an animal? There's like ethics and legality of it.
Yeah, if I'm a
so if it's like a
in
food,
Kansas, way out nowhere,
food animals are very different.
Yeah, like if I don't know, the thing that comes to my mind is a horse breaks a leg and I don't know why.
I think they do consider that ethical because it's quick, depending on just like how people hunt. When people go hunting, they try to go for the correct arteries, obviously, head, heart, major artery things.
Yeah, think about this for a second. Think about how savage spear hunting is.
I find it very.
Think about that.
Just like bullfighting.
That's so like tribal. That's like people with woolly mammoths and spears.
Yeah.
And you're bleeding the animal out.
You gotta think they also respected that animal and used every single part of their body, and they gave thanks and prayer to those animals. Though they respected that the life they were taking
they also
was going to feed their family. Yeah,
but like if you like spearfish like today, it's like damn. Even I always wanted to get into bow and arrow hunting, but at the same time, I feel a little like
it's a little grisly. I feel, and you gotta be.
It's like that gray line of like if you're
gonna hunt, you should be able to hit your target in where you want. So before actually
neither
hunting,
of us are hunters, but like this is just our strong opinions because we love animals.
Outside of falconry, I mean, it's a little hunting, but that's an animal doing its own natural thing. With me there to assist, to help end suffering, type of situation.
I mean, hunting isn't completely negative. Like,
no,
when you have invasive feral pigs, it's like, all right.
Yeah, it's not negative, but I don't always find it positive every single aspect. I think if
like
done
trophy hunting's pretty wild.
It's wild, and I think it's depending on the requirements, because some of those tags or licenses they have to buy, the permits, they either enter a raffle, but they still have to pay like a pretty decent amount, and that goes right to funding for conservation. Yeah. So it's like it's a twisted evil almost, like a
shoot this elephant so we can get 5 more. It's like
I mean, so you gotta find like a happy medium almost. I think you need to be prepared to hunt what you're trying to hunt and be able to hit your target. So obviously practicing before you even go hunting. Don't go all fresh from the cloaca is what we call it, but that's a bird, all in one.
Are we the only thing that hunts for sport, other than like house cats?
Cats, even large cats. I mean, they're obviously gonna eat and take advantage of their food because starvation.
They like to play, and they're weird.
Yeah.
Is there any other animal that really?
I feel yes. I feel a lot of like learning for smaller animals is playing before they have to mature and actually hunt for themselves. And they as puppies, they're running around biting things, chewing on things, jumping on frogs, and eating grasshoppers and whatever they can find. Yeah, and they're puppies or wolves, or I think a lot of young carnivorous animals, it starts out as play. As they mature, it turns into hunting because they're honing their skills as they play. But I feel like we're getting a little off topic.
I'm sorry. We're getting in the weeds here.
Yeah. So
fun little tangent.
Though. I know. Yeah. Typical. Obviously, we'll go back. So humane euthanasia, going to your vet, having a consultation, that's always allowed too. You don't have to jump right to euthanasia. You can have a quality of life discussion with your vet. And I think it's important to have it with family members and friends, because family members and friends will tell you their opinion from the outside view of your animal.
Unbiased.
Exactly.
Because obviously you're clinging on probably for that last
little thing. Yeah. And
that's a reason
you can't
we don't
always
have to.
see, what's in front of you. You see the pet that you used to have. You don't see the frail, malnourished animal that's in front of you now. And, it's totally okay to go have a discussion with your vet. And the vet's job is to tell you the facts. They won't lie to you. They'll tell you this would probably be a good time to consider it. They'll tell you, I think maybe a little bit longer. They won't tell you what you want to hear, pretty much. They won't tell you to.
Interesting actual question on that.
Yeah.
It's kind of. Where is it? Which one? Okay. Here it is. No, not that one. Sorry. Oh, here it is. I had an interesting question. Yeah. Kind of in the topic of recommending euthanasia or not, waiting a couple days or whatever. How does recommending euthanasia affect the decisions that you as a vet tech or veterinarian make regarding the patient when the client chooses to keep trying for another day or two? It's kind of a long post, so I'll try to be quick. I'm researching cognitive biases in veterinary practice. I know veterinarians want nothing more than to heal their patients, but it's hard to ignore the fact that the act of recommending euthanasia creates incentives for the veterinarian to not help the dog survive. Do you agree with that?
They're going to advocate for the animal, is what I'm going to say about that. They're going to advocate for what they think is best. They can't make the decision for the owner. They can't force euthanasia on anyone, but they're going to make the recommendation based on what they feel is best. If people want to keep trying, there's only so much you can try before being you've tried everything. You can try second opinions. You can go to different specialists. You can go further into diagnostics, but they're going to make their recommendations based off of your animal. And again, they can't force you to make a decision.
Okay, yeah, that's fair enough. Whether you think about this or not, you'll have to deal with the fact that you recommended ending the life of a dog who may be still at a fighting chance. If the dog gets better after having recommended euthanasia, the clients will be glad they ignored your recommendation, and I'm sure that doesn't feel good. Trying to determine if this subconscious incentive affects how you treat the dog after having recommended euthanasia.
So I think it depends on what's actually going on with the dog. If it's something that takes a lot of long-term treatment, then go ahead. I mean, I feel a lot of times it's not that situation, though. It's usually very old pets. It's pets with, things that they'll die and suffer at home. We're going to go back to that quality of life discussion, are you just keeping, again, the pet alive for yourself and not for the animal type situation? I think it's just mainly deciding, does this pet get better for the treatment, or is it just a quick fix and is it going to go downhill again? Again, you got to take into consideration what is actually wrong with the pet. Why are we even considering euthanasia? Why are we recommending it? Again, we can't push anyone to do our recommendations. We can only recommend them. What the client does from there is obviously their decision. And, you know, obviously you want to make your pet better. But again, are we keeping our pets alive out of the selfishness of ourselves for a quick fix, or are we not?
Interesting.
I know I kind of just threw that in there. Sorry.
No, it's okay. Yeah. The rest of her question, she seems to be this person seems to be kind of trying to figure out if, like, just because you recommend euthanasia, does that mean you, like, stop caring about?
No.
It's like,
we never stop caring.
Yeah.
You know, I think we almost cared as much, if not more, than the owner, because we know the outcome in the long term. And seeing an animal that we grew up with at the vet clinic, we see them since they were a puppy, or that, you know, we've known long term, or good friends with, or, you know, we have some sort of connection to almost every single pet that comes in. We remember pets before we remember owners. Oh, sure, yeah. And the owners are like, "Oh, we saw you," and I'm like, "I don't know who you are."
Who are you?
And they're like, "We're blank's pet," and I'm like, "Oh," or owner, and I'm like, "Oh my god."
Yeah.
I'm like, "How is your pet?" I don't ask them how they are. I ask them how their pet is. So we care about the animal, and we honestly want what's best. And, you know, if we're making that recommendation, we don't make it lightly. We're taking that to heart as well. And, you know, when that time comes, we're feeling that just as much as anyone else. Yeah.
So it's not just like an easy, quick, like, you know, hand wave solution. It's
never easy.
Is it a thing for vets to send a sympathy card after?
Yes.
Okay.
I find it's very, you know, it shows that we are compassionate. We do care about that animal. We always write one after every single pet. At our hospital, we send a paw print. We'll do like a little ink paw print, and or a clay paw print, depending on what the owner decides what they want. But
the actual, like, their actual dog.
Yeah, for like the bear, for like euthanasia status and stuff like that. But at the bare minimum, say they want group cremation, we at least send a picture, an ink paw print of their pet with a sympathy card to let them know we do care, we do sympathize, and, you know, the pet will be missed.
Interesting. Yeah, that's it was something that never crossed my mind, and I'm reading through, and I was like, oh, interesting, because I've never gone through, like, so this is horrible. So I've got Maisie was the first dog that I've ever owned. I didn't own her. It was a family dog. I was, I don't know, like 2000, I don't know, probably like 2004 we got her. It was a long time ago. She's passed away now. But a couple of years after her, we got a Yorkie who is still alive. I think she's like 17 or something crazy, but she's like on her last leg. And Shirley we rescued, and she's still alive. But with Maisie, Maisie's tough because, so I was living, Sam and I moved out. We were living either here or in West Quincy. I can't remember, but it doesn't matter because my parents brought Maisie in to get put to sleep, and they texted me afterwards. So A, that hurt, and B, this is all like, I don't know, because that's the only dog. And again, they texted me after they
actually
happened. Hey, by the way.
Yeah.
I'm like, what the
I feel like when kids go away is when pet owner or the parents tend to bring the pets in. It's also, we see a spike of euthanasias around holidays because kids are coming home and, you know, seeing the outside view of their pet that they saw before they left for school or before they went away for holiday, or before they went away and coming back for holiday, they're seeing the quality of life of that animal. And we tend to see like the influx because, you know, they're talking to their parents and the parents are realizing and stuff like that.
It's almost like the inverse of anytime I'm at the dog park and there's a new puppy in town. It's like every week I see them, it's like, whoa, they got bigger. And the owner's always like, oh, really? I didn't notice any.
Exactly.
I'm like, no, they got bigger.
They grew up
it's
overnight.
Like, you kind of see that.
Yeah. When I went away and came back from vacation and Fable was...
Right, yeah.
I'm like, you have fur. You're
and
a
so
real
on
dog.
the inverse, same thing. You go away and you come home and you're like, ooh.
Yeah. You really like to
She's
start to
not
see.
really.
Yeah. And not to sound morbid, but people are like, we don't want them in the family photos from Christmas, and because they realize if they send that out, that people are going to see the actual quality of that animal, and they realize like, wow, the quality of the animal is very poor right now. And I think that's, you know, super important to realize.
Are most of the euthanasias you do going to be from age, or for the reason of age?
Age or age related diseases.
Yeah.
Kidney, renal stuff, liver, internal organ functions failing.
Is it a low percentage of like emergency, like middle-aged younger dogs?
Sadly, it's just, you know, I feel like I see every age group. At the ER, I see every age group. Either it's time for the pet or it comes in for...
Can you handle puppies? Is that tough?
I'm assuming I haven't done one myself. I don't want to be involved with those. Just like behavioral euthanasias, I trying to stay clear.
I got.
Oh, one of those.
Let's talk about that.
Okay.
I actually haven't read the post yet. I just grabbed it because of the title.
Oh my gosh.
And the title, Considering Behavioral Euthanasia. Help. So I feel like this was like perfect. Like, let me throw this by Courtney because she's very against that. I'm considering behavioral euthanasia for my dog. And I could use some feedback because it's a pretty tough decision and I don't know which way to go. We'll call him Doggo. He's a 9 to 10-year-old pit mix who I adopted about 4 years ago. His first 2 years were great. He and my other dog were bonded, and they really did well together. My first dog died 2 years ago, and Doggo really struggled. He started peeing in the house, getting anxiety. All of this was mostly managed. He struggled some with anxiety and had some accidents in the house. Oh, sorry. For some reason, she's just rambling. So this is where we're currently at. Honestly, that doesn't... Sorry, just real quick. It's like anxiety and peeing in the house. Oh my God, you're going to kill it? Sometime in the last year or year and a half, he slipped his collar when we were sitting in the front yard of a friend's house waiting for a person walking their dog to go by. Ran straight to the dog and attacked him. No damage was done, and I wonder if that means there was no blood? Or if there was, because, well, I don't know. No damage was done, thankfully, but I still cannot identify a trigger to that incident. We took a reactive dog class, and he was okay for a long time. So it was a year and a half ago. In July, he attacked another dog in my home, this time a 12-year-old blind pup. There was a toy involved. He did not release on his own. I had to literally pry his mouth open. The wheelbarrow and other methods I had been taught in class didn't do anything. I don't know what I assume that's maybe grabbing their legs. Their back legs?
I don't know.
You know, kind of like a wheelbarrow. But so he did. So this dog, he did damage. She needed stitches for a puncture wound on her snout. Decided to put him in a separate room while I figured out a plan. The first day I tried to put him in that room by himself, he chewed / dug at because he's bored. Attacked the walls, etc. He will do the same thing if he is ever put in a crate. Did some rearranging of things. He put the dog he attacked in the spare room. And I saw the vet.
Just curious why this dog is still at the house.
I know. It's like... Yeah. This is interesting.
So far it sounds like they haven't done any training except for that one class years ago.
And
they haven't seen a behaviorist. They haven't gone to the vet for diagnostics on why, especially for like the urinating in the house.
Yeah.
And
it's crazy how some people like don't care or don't notice some of those.
Yeah.
Like for me, I'd be like, what the hell is going on?
Yeah. And then what if you know your dog is triggered by certain situations, why would you keep putting them in the situations if you knew it's not doing well? So I feel like the owner shouldn't, one, because again, I'm personally against them, but it sounds like he's not going through the steps to do like an actual behavioral euthanasia where you rule out everything. I feel if you're going to do a behavioral euthanasia, you need to rule out everything. You need a personal trainer, not a class.
So they do mention going to a vet real quick. Sorry, this one's so effing long.
Go ahead.
This one's real long. Sorry. So I guess it'll be real nuanced. We'll see. So after that, he went on Prozac and a common care supplement. They were slowly reintroduced and seemed to do fine. But then he started urinating more often. So
it sounds like he needs Proin he may just have, the sphincter losing control of the urinary bladder. So.
And then about a month ago, I got married and my husband moved in. I understand this is a big change for Doggo. He did okay for the first week or two, and then his behavior skyrocketed seemingly overnight. Obviously, that's not enough time for a dog to get used to like someone new in the house. But within 5 minutes of me leaving the house for work in the morning, he's pulling things off of shelves and counters, anything he can reach, urinating in large amounts.
Also sounds like diabetes to me.
Yeah, a belly band.
To push the urethra up against the body so they can't pee.
Okay. And it's undoubtedly doing damage to So
it sounds like he has a urinary issue going on, either via, potential diabetes, potential loss of control of the sphincter. Doesn't sound like behavior. No.
I mean, the biting, obviously, but...
That's behavior. I think this owner is just trying to find a reason to euthanize this pet at this point.
Yeah, they say when they do go into the vet, all blood work is normal, thyroid and electrolytes, UA. What's UA?
Urinalysis.
Okay, came back totally normal.
So he probably should go on Proin. It sounds like he doesn't have a urinary tract infection. Blood work, he doesn't sound like he has diabetes.
Trazodone?
Trazodone's a sedative.
Okay. Yeah, so they... Oh, and they mentioned, again, snarling and curling his lip at the blind pup. Again,
he's probably not comfortable with a dog in his house.
Yeah.
That he doesn't know.
Most recently, he was headbutting doors and baby gates. Oh my!
It sounds like he's understimulated.
He's frustrated, yeah.
Not exercised enough. I mean, I don't know.
I'm highly concerned he's going to hurt himself and other dogs. My vet told me she feels like she's reaching the end of her expertise. I feel like she's probably lying to the vet and telling the truth online.
Probably. And then even if she was reaching the end of her expertise, that vet probably recommended a behavioral consult with a behaviorist and a specialized trainer for specifically this dog, who would probably see the in-home, because the behaviorist and trainer go to your home.
Yeah, because she's somewhere. The house is getting destroyed. My husband's not getting any sleep because he's constantly woken up by Doggo trying to do things, and there's pee everywhere. I'm speechless at why you would.
So I would never recommend. Again,
why is she thinking?
So this is what I see a lot.
How do people think that's okay?
This is what I see a lot.
You can fix that dog. Okay, it bit another dog. It's not happy with the other dog, but that's something you can work on. Everything else seems like it's a real easy... It doesn't have to be around
other dogs. That's like a thing. You don't have to bring it around other dogs. Don't bring other dogs into its house. Mm-hmm. It's its house. It clearly has something going on urinary-wise, or you're not taking the dog out enough. Like,
so this person just seems like it's maybe a them issue then, yeah. Which sucks for the dog. This is why I've been advocating so hard lately for dogs, because like, what a shitty situation. This person
explained a shitty situation that they're putting their own dog in.
I'm in my head brain dead right now at how stupid this is.
Yeah. She's looking for someone to confirm, to like, support her in making the decision. Because probably her vet probably
Is it not better for her to just rehome it? I know that might maybe be difficult.
I think if she loves this dog, she should go through the behaviorist, the training, the medication. Trazodone's totally fine. Prozac's totally fine. Those drugs are meant to help with training and the progress of training, to make the dog more malleable almost. And it's just like a tool. You're not supposed to use it long term unless that dog has anxiety issues. There's long-term anxiety meds, doggy Prozac. But it sounds like she is just giving up on the dog. And that's what I see a lot of is people just like, give up, or they don't want to spend the money to do the diagnostic. They don't want to go to the vet. They don't want to get the diagnostics. They don't want to do anything, they just want to be like, this dog is destroying stuff and I don't want to keep it.
Dog.
Yeah. They
Literally
blame the dog.
Yeah. When like literally, okay, it's digging at the door and destroying your house because it literally is so bored.
Yeah.
And frustrated. It's frustrated.
It's frustrated and it sounds
again, going back to prisons real quick, if you go watch things of people in like solitary confinement, they're slamming on the doors all 24/7 hours a day because they're just stuck in a little cage with nothing. Like, it's brutal. Yeah. That sounds like a case of poor dog. Yeah. I feel really bad for that dog. Damn.
Yeah. Again, sad. That's why I don't want to be a part of them unless the owner actually tried everything. Which
this person clearly has not tried everything.
Exactly.
They're asking Reddit for an opinion as opposed to going to a professional.
I don't even think she's asking for an opinion. I think she's looking for someone to agree with her.
On like biased confirmation or whatever.
Yeah. So, yeah. One of those is that one was sucky, but
I do have a couple shorter ones that are interesting. This one, without even like getting into reading the specifics, essentially. So my question, without reading like the earlier post, he's okay with like what happened. He has a more question on the billing / like, I think his dog died like. All right. So my question is this: by telling me that she started to pass on her own while they were prepping her, the text seemed to indicate that they didn't give her any drugs whatsoever, but it was still charged as if they did. Are euthanasia drugs the sort of thing that once prepped must be used or discarded?
So prepping may have been pre-meds.
Okay. Which is different than what is it called?
The Euthazol.
Euthazol. Okay.
But again, they may have asked if they could go forward with the euthanasia because she was passing, to kind of help her with the process and use those drugs. Euthanasia is weird. For, if a pet passes before you even come to the hospital or at the hospital before we give stuff. I think mainly if it passes before or you come in or before the actual pre-med or euthanasia solution is given, I think typically it's just like the charges for cremation versus burial versus other.
Okay. That makes sense. So they probably in that case, like, gave them something, put work into them.
Yeah, I mean,
you guys don't do it for free, I mean.
Yeah, and I hate that. I hate that we can't.
I know.
I wish I could do everything for free. I really do, but the price to keep a hospital open is for the medications and the products and stuff. So if we use those products and medications, eventually that fund is going to run out.
So are you taking, so my sister has diabetes. Mm-hmm. She's got a bottle of insulin that she would
Our insulin is cheaper than human insulin. I just want to put that out there.
Dog is this?
Dog insulin is cheaper than human.
Same exact thing?
It's different.
Okay.
It is different.
Okay.
But it is cheaper than human because I know human insulin is probably very expensive, and I know people are going like across the border to like Canada to get like a 4-pack or whatever.
Ugh, that sucks.
Yeah.
She has a pump now. She's had a pump forever, but before she had a pump, you know, it was syringes, taking the insulin out of like a little bottle that was in the refrigerator.
That's what they do for animals. They kept refrigerated bottles and they draw it up and give it to the animal.
So is that the same with was it Euthazol? Euthazol, is that, or do you like open it? Is it once it's open you gotta use it?
We have a big bottle and we pull from the bottle, so you're paying for the product that you use. So if we didn't get paid, like we can't purchase. Milliliter. Yeah, exactly. For euthanasia, it's a set price.
Oh, okay.
But for like other products and stuff, it just depends on what the product is. If it's like we have like a big bottle and we can draw some out, we're just paying for the amount. But if you're selling like a small, you know, say ear meds, no one else is going to be using those ear meds except for you. So you're paying for that actual product. And the money towards that we get from that product goes back into buying more of that product and paying the employees and making sure, you know, we have everything we need to keep the hospital sanitary. So what you're paying for at the hospital is keeping the hospital running. Because if we didn't have that, there's no such thing as unlimited funds. Once we run out, we run out. And, you know, so for euthanasia, you're paying for the Euthazol, not the amount, but for the actual euthanasia, you're paying for the doctor's time. You're paying for, you know, whatever option you choose for your pet afterwards. And you're paying for, you know, the overall product. Not per meal, but
afterwards. Can you take it? Take the body?
Yeah. So I have a little thing here. Where are you?
Because actually that's something I didn't even think about.
Yeah.
When we're done, what the heck happens?
You're skipping around my paper here, so I gotta find it. Let's see.
Because I can't imagine they've got like the you know, funeral car that comes in.
So
a hearse.
Not a hearse, but it comes in a big van.
Oh, great. Just stack them all in there.
You're making it more morbid than it needs to be. I don't like to tell people that. Am I missing this paper? Well, you have a couple different options. Here it is. So there's at-home euthanasia, where the vet comes to your house. I like this option because your pet is comfortable in its home. It's with people it loves. Usually people lead up to, you know, that they have a really fun day. And then it leads up to, you know, the picnic blanket out in the yard or in the favorite family room. The pet isn't stressed.
It's like a normal day.
Just a normal day, you know, just ending in euthanasia. The only issue with at-home euthanasias is it's not like a same-day thing. They book out a couple days to a couple weeks. So if you know your pet's slowly declining, you're going to have to schedule something. And that's something, you know, a lot of people don't like to schedule the pet's death.
Yeah,
it's kind of hard for them.
Concept.
It's a weird concept, but I almost like it because you're scheduling it so that way you know past that point your pet's not going to continue to suffer. If it is suffering, you know, and, you know, sometimes it's just time. The other issue is it tends to be more expensive because you're paying for the vet to travel to you and then take the pet with them to go to a crematory. And it's just a lot more travel, and it tends to be a little bit more expensive. But on the plus side,
plus you're only, I mean, just from your guys' side, you're doing one, whereas, you know, you might be able to do 4 at a time or something. That is there ever multiple at a time, or is it usually just okay?
It's usually just one.
Okay, I don't know how, like,
yeah, I mean,
30 dogs being put down.
There's sometimes multiple pets coming in for euthanasias, but they're not together. They usually either have their own room or they wait until the room's free because, you know, again, it's still scheduled at a hospital, but there's a little bit more flexibility. So in home or at hospital, in-hospital euthanasias tend to be a little cheaper because the person doesn't have to travel around. The crematory comes and picks them up themselves from the hospital. But the minus is, it's a little bit more stressful, especially for a high anxiety pet. I don't recommend it. So high anxiety pets, I do recommend at home euthanasias. But again, you got to kind of plan it. It is more expensive.
As somebody who always tries to plan ahead and advocate and think for my pet, that just seems like something that I'd want to actively set up.
Exactly. You want to think about and be prepared.
Yeah, having somebody come and...
Yeah. I mean, that's what I would do for my own pets. My first dog, I had a in-home euthanasia.
Really weird question.
Yeah. Possible answer.
Yeah, you can't do it.
I can't do it, but I can do the catheter, I can prep, and I can,
could you have, your friend vet or whoever, someone you work with, come over and, you two do it at your house?
Yeah.
Or would you personally rather have, a stranger vet? Like other people come in and do it, and you...
I'm fine with someone I know, just because they know
or I guess
care
more,
for their...
Do you... When... Oh, God, sorry, I don't want to make you think about it, but
It's okay, go ahead.
When... And who knows, the answer might change, but when you... Shiloh and Fate, do you want to be part...
I won't be the technician.
Okay.
I will be the owner.
Yeah.
At that point. I won't do my own things for them.
Okay. And you don't want to, right?
No. I don't want them to remember me poking them for a catheter. I want them to remember.
I know.
No,
it's
fine.
A deep, weird...
It's fine. That's an actual good question. As a technician, do you do your own things? I know a couple technicians who have done their own things and prep their own pets, and, I just don't think I will personally do that. I'll be present at all times, though. And even while they're doing, the catheter and stuff, that's me. I want to be there 100% for my animals. Yeah, I can't picture it any other way. And that's why I think I have a hard time with other people who just leave their pets. And I'm like, I could never do this to my own animal, so I don't know how you can do this to yours. And I don't want to sound judgy, but I'm kind of judging at the same time. I don't say it to them, but...
I do. So I personally have a hard time with death. I think it'll be different with my dogs because...
They're your own animals.
They're my animal, but even with close family, with my grandfather, who's literally one of the biggest influences and probably shaped my...
existence.
I can't even. He was such a good friend and oh my God. Something that I can't describe in words. But I feel real guilty because someone that I loved as much as him, when it was I can't do hospital visits. I struggle so hard mentally and
I think it's also harder because he can communicate with you.
Yeah.
Not the way an animal does.
Mm-hmm.
But I feel as
I feel
humans,
guilty. I never said bye to him. It was
But he knew. That's the thing is, he knew. The animals don't know. But he knew how much, you meant to him and vice versa. We understand that, we don't always get to say goodbye to our loved ones. And sometimes we don't, because we don't want the actual aspect of saying goodbye to be the last thing. We want to remember them as they were.
Maybe that's what...
I think that's how I kind of feel towards it. You don't want that to be it.
Mm-hmm. So...
You say goodbye and that's it.
Yeah, my grandma... So that I was just talking about my mom's side. My mom's dad. So my mom's mom is my last grandparent alive, which is weird in itself because I've had the thought of and I know this has nothing to do with dogs. Sorry to go on another tangent, but the thought of well, once she's gone, right? like as far as the lineage, it's like, whoa, parents are next, and then
Yeah.
me.
Reality
It's
there,
like,
yeah.
we're starting to,
Break
but
it
so,
down.
and she's starting to like decline. And again, though, I struggle to like, she only lives in Quincy, right behind the Quincy High School. And I struggle to visit her. It's very easy for me to go visit her right now.
But again, I think you're thinking maybe you don't want to see her as she is now, as she's
can't,
declining.
Because we have such good weird memory. It's so hard to.
I think in these situations,
But I feel guilty.
I think you should talk on the phone.
I feel so guilty.
I think talking on the phone, so you don't have to actually see her, but you can still have those good conversations. I think
I'm sorry to get like emotional now.
It's okay. Therapist Courtney here. And that's how I feel for people too when euthanasia. I feel like I'm a therapist somewhat, but I think humans and animals. I think being there, you don't have to be there physically for the actual euthanasia for the animal. Like I said, be there for at least until the premed. So they don't remember the last thoughts, looking for my mom, looking for my dad.
So actually, that answers this question. Yeah. Could my dog see, hear, or feel me at the end? He had been slightly sedated beforehand. I just want to make sure he knew I was there with him at the end. He seemed to look right up at me before he passed, but I'm worried he's so out of it that he didn't know I was there. It's really bothering me.
So he knew he was there for the pre-med. Like I said, they can't close their eyes. They don't look, once the pre-med hits, the nervous system, they can't move their eyes. They can't, I know.
Do they blink? Interesting.
We have to loop the eyes for anesthesia because
Wait, did they have to do that to me when I go under?
Probably. Or they use drops, eye drops. We have actual lubricant that we put in the eyes. Yeah, so I think it's, like I said, anesthetic depth. When you get, humans, when we get knocked out, it's just we wake up and we're like, where did all that time go?
That's so crazy that you can do this, right? You can get them to this point to where we can just come back from that. That is just bizarre.
We control, there's multiple aspects that we control.
Like if you didn't euthanize him, right, he could
come back, yes. The
That's
drugs
so
wear
crazy
off,
how we can put that pause like that.
Yeah, it wears off. It's not instant. It's slow.
I don't know why that blows my mind.
Yeah.
It blows my mind that we can just...
I think the dog knew he was there for when he went out, but past that, the dog didn't feel anything.
There's
nothing. Because just like with humans, when we go out and we wake up hours later,
jump cut,
we're like, whoa, what happened? So I think that's how it is for them, and that's what I hope it is, because I don't want them to feel anything. And any vet who doesn't use a pre-med and just pushes a euthazol on a live animal is not a good vet, in my opinion.
Would that physically hurt?
It's shutting down your nervous system and your brain while you're still awake. So you feel, I think you experience death. You literally suffocate to death while awake. That's why we recommend it, because the euthazol sets them into cardiac arrest. So you're feeling the cardiac arrest because you didn't get the pre-med to feel that. And
probably just have a manic panic attack.
And I will say I unfortunately had to experience that for euthanasia one time, and I was not okay. And it was a euthanasia or a behavioral euthanasia. I'm gonna get all teary-eyed. I get so worked up about it because I thought they were pushing pre-med or propofol, the magic milk. Michael Jackson loved it, and she didn't, and she just pushed euthazol, and that dog was literally convulsing and struggling to breathe, and that was not how a dog should go out. A dog that's already fearful and scared, and
That almost seems like an equivalent to the like electric chair in the sense of you're sort of like.
it was horrible. I felt sick to my stomach.
That's like when you cut a chicken's head off and it's still like, it's almost like, you know what I mean?
Yeah.
Damn.
That wasn't, I don't like talking about it because I get emotional about it, and it'll haunt me forever that I had to experience that the dog had to experience that human inmates that are getting the chair, or not the chair, but the drugs are, people who do bad things still get the pre-med. And this dog who has no idea what's going on is getting fought to the ground, muzzled, and then gasping for air.
Yeah, it'd be like if an alien spaceship abducted you,
Yeah.
right? Like, like you said, we're aliens to them.
Exactly. The dog was so fearful, it was so scared, and I was sick to my stomach. I had to walk away. Like, I was like, I got up and I'm like, I can't be a part of this anymore. And I reported it because that's not something I'm ever comfortable with is. And I hope, the necessary measures are taken to, reprimand that doctor. And I don't know, pushing euthanizing without pre-med is just crappy in any situation. There are some doctors in cases that it is okay, like if the pet's already on its way out or so extremely ill that you don't have time for a pre-med, and the correct choice is euthanasia. I'll see doctors do that.
What if
but this was a
spry
2-year-old animal, young, fearful, and like that.
Well, like you said, behavioral, right? That's not.
It was
really,
a behavioral euthanasia.
Is behavioral really medical? I mean, that's a blurry line, I guess.
It's a blurry line.
But
because behavioral is, brain. Medical, is there something medically wrong with it? Did the owner not want? I didn't ask for the case information because I didn't want any more info about this. I didn't want to know.
Well, it might be like I just read earlier. It was
that
just
they did
peeing on the damn floor. It's like,
I think this one did have a bite history. That's why it was fought to the ground and muzzled. And that's when I was informed that the owners did not want to be present. And then I thought they were giving the pre-med when she was actually giving euthanizing.
So, all right. So you're against behavioral euthanasia. In my experience, so all the dogs that I watch are obviously pretty good. I personally only know of these type of things in these online things I read, where these
you get
dogs
the owner's view.
Yeah. I've never really encountered, like a dog like this where it's like it's got a bite history. So like if somebody came to me seeking professional help, I would say, sorry, I'm not a professional in that way because I can't help you. How do you and you might not know the answer because again, you're not a professional, but how do you actually correct like a biting or like an aggression?
So you gotta find what triggers it. There's always a trigger. Something that sets the pet off. It can be as small as, dropping a glass.
Is biting like if there's a bite history, is that something you would consider behavioral?
Yes.
Euthanasia?
Well, I don't.
If they're putting it down for that I mean, I know it depends on the circumstance. If
it's biting and like I said, everything has been checked off that they've tried for the actual euthanasia. They've sought medical help. They sought a behaviorist. They sought a professional behavioral trainer, not just a PetSmart group class.
Or I mean, honestly, even
and they tried medications.
Even some of the trainers that tout themselves are honestly full of shit.
Yeah. There are, the behaviorists will give you legitimate trainers. They will recommend, they'll come to your home.
MJ's Pet Academy. Oh my God, I loved her post.
I saw. She She was at the dog show.
Like, you gotta find somebody like them. You can't just find somebody like me. Not to give myself
knows what to try.
any discredit. Yeah. Like, I know dogs. I can help a lot of situations. Like today, I won't say who. A dog that I was watching who was tortured as a puppy and left in the woods to die at 6 months old. He was rescued. He's lovely. Humpy boy. He doesn't like my dad. He loves me. At the dog park with me, any man can approach him. He's pretty fine. He hates my dad. With my dad, he'll nip at his hands. Which tells me maybe somebody like my dad is probably who abused him. Yeah. Well, today they had someone like putting a cabinet in and he... And so we do have a plan moving forward, which is key.
See, they're working on steps to prevent the behavior.
Yeah. Like we're gonna anytime somebody comes over, so I'm not a professional, and I gotta tell them, so our plan is we'll put him in the crate like anytime I pick him up and anytime strangers come over, so he knows when people come over, let's go to the crate, let's calm down for a little bit, and we'll come out once we're like relaxed and we're in a state where we're not, because I was about to say what breed, but I don't want to give away a dog. For lawyer, I don't know. He's a good boy, but he can be, I guess, protective of his mom, and the two breeds he's mixed with are kind of nippy.
And that's what people have to also take in consideration when they do behavioral euthanasia. They get a dog that's already predisposed to biting. They got a freaking German Shepherd who's a working dog that's meant to be guarding and herding.
He's living in, and if he's going to be
not getting any socialization or actual work, he's going to bite and do damage, and he's going to have behavioral issues because you didn't do anything with him. You didn't set the ground rules when he was a puppy, and now he's a mess. Behaviorally, mentally, physically, a mess. And
so at least, like you said, they're taking the steps to... And now, do I feel comfortable addressing this? Yes, because he's never bitten anyone before. He just kind of nipped the worker guy, and then he calmed down. And
he could
it's
set
a dog
trigger
I
off.
know.
He could set a trigger off for the dog.
Yeah, I don't know anything about that guy. Dogs are weird. Yeah. They pick up on things that we don't even... I don't know
the exact story, but he could have dropped something. He could have done something that the previous owner did and abused him and set him off.
Stranger in the house.
Exactly.
Not
it's a stranger.
That's not I'm not condoning.
No, it's not.
There is a why, though.
Yeah.
I'm not condoning, but there's a why. And so... Do I feel comfortable addressing this specific one? Yes, only because it's a dog I've known for like 3 years. Yeah. And I love and I watch him every day. Yeah. So, yes, I will. But if somebody was to come to me like with this out of the blue, I'd probably be like, I don't know. You know what I mean?
And
like,
that's when they should seek professional help.
I'm not. So it's just...
Because you see the dog and you know its lifestyle, you know... its past, are the owners actually going to do stuff to prevent it again, then that they're doing the right things. But if you're not doing anything to help the dog, then you're not doing anything to help the dog.
Just so I don't understand what's the point of getting a dog if you're not going to constantly think about how you can help and improve their lives.
Exactly. Don't get a husky and sit in your room all day playing video games while the dog is literally going out of its mind. That's supposed to be running 20 plus miles a day.
Yeah. So I totally am victim of that on some of the weekends sometimes with so obviously I don't neglect them or anything, right? They get plenty of exercise, but sometimes sad because I never say no. If somebody's like, "Hey, can you take my dog?" Yeah, I can take your dog. Because I don't go on vacation. I'm kind of a homebody. And so, all right, I'm thinking about tomorrow. I got the event 1 to 5 p.m. tomorrow. Well, before then, all right, we'll go to the dog park.
So you plan your dog's exercise. That's good.
Yeah.
That's what I do. I plan my dog's exercise. I'm going to work from 7:30 to 4. Afterwards, we're going to go run.
I love that. Yeah, exactly.
For 2 hours until I come here.
Yep.
And then next day, I let them run in the morning. And then I have a wedding to go to tomorrow. So my sister, congratulations. But
shout out.
But I'm still going to find a way to exercise them to the best of my ability so they're not, like, I'm looking into dog walkers for, days that I'm at work so they can come to work with me, get picked up, walked, and then drop back off. Like, that's what, and then afterwards I'm going to walk again. Like, they're
your life.
They're my life.
Yeah.
If you get a
so,
dog,
I already know, like, tomorrow, like, all right, it's like, all right, I'm going to run them in the morning. I'm going to come home. I can play some Apex Legends on my computer. And then I've got that event. Well, I know between coming home from the dog park and leaving for that event, I'll play video games. Maybe they're like 2 hours, right? She'll nap for like an hour after coming home from the dog park. And then it's just like, all right, I'm ready. And she'll start whining and I'll be, all right, give me 5 minutes. Like, I know that, and if you don't, so like, fortunately, she's someone who has me who will, but like, oh my God, I can't, it's long point of getting to like, yeah, holy crap. I can't imagine getting a dog and just like basically ignoring it. So.
Don't let it just sit and rot in the house. Don't let it sit and rot in a crate.
Mm-hmm.
Like, don't get a dog.
Yeah.
Oh. Okay. Back to our many things.
Yeah.
I mentioned before.
Back to killing dogs.
Yes. Yeah. Sorry. We going over the both options in home and at hospital euthanasias. There's also options for private versus communal burial, or cremation. You have 3 options really. So private.
Are all pets cremated?
Not all of them.
Okay.
3 options.
Okay. Oh, sorry.
Cutting me off. Who do you think you are? Private, meaning cremation. You go to the vet, your pet gets euthanized, goes to a crematory. They're cremated on their own, and depending on if you want, like, it's stuff cremated with it too. Some people bring like blankets and teddy bears and leave the collars, or they take the collars. Anything is okay, honestly. And you get those specific ashes back. You don't get anyone else's pets. If it's a legitimate crematory, don't go to the one on the side of the highway that no one else uses.
It's a little can of dirt. What the heck?
Yeah. They'll they'll bring the ashes back when they come to pick up the next section of pets, let's say, that are going back to the crematory. And
you have a pen over there?
I don't have a pen.
Okay. Just remind me to ask you about taxidermy. Continue.
Okay. Taxidermy. I like taxidermy, so that'll be fine.
Because we're talking about cremation, so
yeah.
Eventually add taxidermy into this little, like, what are your thoughts? And so
that's...
Add that as one of these little options.
It is, because it goes kind of with number 3. So back to number 1. They typically give you an urn or like a picture vase, or they send you something. They have like a sad little card talking about the Rainbow Bridge that you cry just opening up and looking at. And then like paw prints and stuff.
Those things kill me. Even when it's not even, it can be
anyone's
because
pet.
It's not about.
It's
not about the.
Yeah.
Like, it can be your pet, but I have those same exact feelings that you're having towards my pet. And it's beautiful that we can bring that out in each other. Like,
yeah.
You can post something, like, I love when you post beautiful things about Shiloh. Shiloh ain't my dog, but it reminds me of my dog.
Yeah.
I
think this is the pomo.
Are you gonna make me cry?
Yeah. There's a couple versions of it, but this one is just this side of heaven is a place called the Rainbow Bridge. When an animal dies that has been especially close to someone here, that pet goes to the Rainbow Bridge. There are meadows and hills for all of our special friends so they can run and play together. There's plenty of food, water, and sunshine, and our friends are warm and comfortable. All the animals who have been ill, old, are restored to health and vigor. Those who were hurt or maimed are made whole and strong again, just as we remember them in our dreams of days in time that goes by. So it's just,
I'm thinking of literally, you take Stoddard's neck and me and my 8 dogs and just put it up into like the heavens, and it's like, oh, okay, that's what heaven is.
And there's longer ones, and I'm like, I can't keep looking at these because I'm gonna get emotional. But
I know I got tears in my head.
You get one of those and cry, and I am too for certain things. Number 2 option is communal cremation, which is, again, totally okay. Some people don't want those ashes and those reminders. They have their memories. They have, a collar or blanket or stuffed animal that they keep. That's when the pet is euthanized and then goes to that same crematory, and they go in and get cremated, and then their ashes are combined with another, like a bunch of pets. And typically they have like some type of garden that they spread the ashes. They don't just keep the ashes or toss them. They typically put those ashes somewhere. Again, typically it's a garden, because it's weird to say this, but it's nutrient rich, the ashes and stuff for plants.
I'm so unsure of which one I want.
And either is fine, honestly. People feel
I'm so unsure. So unsure. I have no idea.
Cheaper to do communal. I know price isn't always an issue, but some people.
That's not even anything to think about. That's heavy.
Yeah, that's something to consider and think about.
Do I? So like my grandma, like I mentioned earlier, yeah, she she's got Cooper the cat. His ashes are up on the mantle. Do I? Oh, man.
I do find sometimes.
Ooh, that's tough.
When you get pet ashes, they do get tossed aside eventually somewhere. They get dusty, and
it's sort of
they're
like
not
something. So maybe at first
it's like a big thing, and then over time, as you heal, those ashes kind of take a step back. But again, either is okay, because you have the option, and you're going to remember that pet regardless. The memories.
Well, I guess if I look at it from my point of view, my point of view is shit. When I'm dead, I don't care what you do with me. So I guess.
And the animal doesn't know either. Like your pet's not going to know.
Dead, right. Again, hoping that the soul outshines the body.
Exactly. And then number 3 option is taking your pet home for burial. There's strict laws on burial.
In what sense?
Because
or like what
you're putting euthanizol into an animal. We talked about how it shuts down the brain and nervous system. So if you bury a pet and the pet decomposes, and that the chemical and rain and drinking water, you got to think about that. So if you have well water, obviously it's advised against, because if the pet decomposes and rain and going through the body, there's also scavengers. You legally have to bury your pet a certain depth.
So I can bury Bailey.
You can, but if you don't,
where?
I don't know specifics. There are pet graveyards.
Find a lawyer. Find a pet lawyer.
There are.
I mean, obviously, I can't go to Starter's Neck, her favorite place, and just bury her.
I think you'd have to ask for the town permission.
My backyard?
I think you can do backyard. Again, consider well water.
So you can buy a house and not even know that there's like 12 dogs buried back there.
Exactly.
Holy shit.
But you also have to keep, like, if you don't bury that body enough, or you have a determined scavenger, coyote, fox, raccoon, and you have to bury, and you have to clean up your scattered pet's remains. That can be really rough. On top of that, if that animal ate your pet, it could potentially kill that animal because of the euthanizol in the system. I don't know how it's processed differently because it's not in the veins, and it's being digested, but I think it does still end up killing that animal.
I can still see that not being a great scenario.
No.
Even if it doesn't kill it, that can't be
not
good,
great. Yeah.
You know?
So you got...
Plus, I wouldn't want an animal eating my dog.
Exactly.
It's dead body.
So that's...
That's like, yeah, I'm good.
Something to consider. And then the last part, kind of going with taking your pet home after euthanasia, is taxidermy.
Yeah, have you ever dealt with any?
Not dog or cat, but exotic animals. I see a lot of snakes. They'll articulate the skeleton.
A snake?
Yeah,
it doesn't just...
It does look pretty badass. I think.
No, but that doesn't flake and just disintegrate into dust, isn't it?
It's it's bone. It's scale. It's hard material. I mean,
because
you see how
they shed the skin.
They shed the skin, but that's not the actual skin. It's a layer of, just like how we get sunburn, and we peel. Okay. That's them shedding as they grow. So as they're growing, the skin is expanding, so they shed that. Or they're just going through natural shedding, which is...
I'm just thinking of a, little, snakes posed to strike. That would be pretty cool.
There are skeletons like that you can purchase. People will articulate roadkill skeletons, and as long as it's legal, there's some state laws, because there's federally protected animals that you cannot and can possess. For, taxidermy, I see a lot of birds, a lot of snakes. When you get your snake skin shoes.
Did you just say that there's certain dead animals I can't own?
Exactly. So birds
hold on, it's a corpse.
So you can't prove cause of death.
Holy shit.
So say you pick up a dead red-tailed hawk on the side of the road, and someone reports you for picking up that dead bird, or you post a picture and someone reports you, you're going to get slapped some hefty fines. And you can say you found it all you want, but, if you did, taxidermy to it, they're going to be like, you shot the bird or you killed this bird.
So would you need some sort of paperwork? Like if you have a taxidermized tiger, is that even a thing?
I think there's, yeah. Oh yeah.
I'm sure it is. It's
you can get any animal. It just depends on legality of it. And if it was, black market stuff,
Is that weird?
No. I don't think it's weird. Personally, because it's called vulture culture. So you scavenge dead things.
I can see, okay. I could see doing a wild animal. A coyote that I found, do people taxidermize their pets, though?
I do find
there's no way you could see, I hate, but
if they stuffed them.
It's fucking weird.
I feel like it would be weird to me, but, every person, memorializes their dog or cat in a different way. So I don't think it's wrong. And it's not right for me.
Sorry.
It's not something I would do.
Did you ever see I have to put it in, oh my God, the taxidermized cat that they made a drone.
Oh, yeah.
You've seen
so that. I think at that point that's just exploiting the animal. And it's not really...
I hate to laugh. I'm not laughing.
I know.
I'm just drunk
it's messed up.
I'm drunk.
It's stupidly messed up. I think at that point it's just kind of...
We're weird. We're the only thing that would ever do that. A bear would never... a bear would never have a pet.
No. Because they're not... They don't think, like I mentioned earlier, they don't grasp concept or think as, as much as our level.
We're really aliens.
We are. We probably came from an alien spaceship. Got dropped off. We think aliens are out there. We're actually the alien, How did we
Seriously.
start, you know?
We're
I mean, obviously,
Thank
started
you.
from
Like, I love picking
monkeys
your
and
brain
apes and
because
stuff.
so as much as I love to share this with people to like try to help people, like I love picking your brain because like a lot of this is like I'm just thirsty for knowledge.
And I
you
got
just
weird knowledge
continue-
here.
You continuously blow my fucking mind. Because seriously, we're the only animal that's so. I don't know if you watched the whole video I posted yesterday,
Yes, I did.
but I talked about like bees make beehives one way. They don't ever change the way they make beehives. There's not we found out a way to do it quicker. Like it's just the same. We're so different.
We are different. Just keep in mind, animals do evolve, slowly over time, over thousands of years. It's not overnight. So the beehive could have been very different.
Google this when you get home. Chimpanzees and orangutans.
You and chimpanzees.
I know, entering the Stone Age.
Yeah.
Using tools.
Exactly, and that's
teaching
technically where we started is them.
Crazy.
I know I said we were aliens, but scientifically we started from them. Yeah. Apes. And we progressed, and our intelligence progressed to us getting to this point. Mm-hmm. And now here we are. Technology is crazy, like a picture that's moving, and
but like dogs won't do any of this.
No, they'll evolve, but I don't think ever to this point.
It's just crazy. What are we? I mean,
Monsters.
That's the $1 million. That's the $1 million question.
I know. What the hell are we? And what is afterlife? Number 2. Yeah. But yeah, back to taxidermy. I have no issue with it as long as you're not taking advantage of the animal's corpse, like making a drone out of it. I think that's just not respectful at all.
Hilarious, but
it's funny for the moment, and then you think about it, you're like, wow,
holy shit,
that was an animal. That was a living being at some point.
I could see like
taxidermy can be very beautiful.
I love it in like museum type settings. I feel like that'd be really cool.
It is cool to see, and people who can do it and do justice to that animal's remains.
Because I've seen some butchered.
There are butchered, and it's sad.
The cats and stuff it's just like, oh.
I mean, some people gotta start out somewhere, but if they can do that animal justice and try their hardest, I think it could be very beautiful and very sentimental.
How do you start? Where does that interest begin?
I mean, it could start from anywhere, honestly.
You think?
You can start on your own, watch YouTube videos, watch videos online. You can talk to actual taxidermists. There's 1 or 2 in every state, at least.
Why do we do that? Why do we taxidermize?
We're weird.
Animals? Yeah, but why?
I think to memorialize the animal. Some of these taxidermied animals are very beautiful pieces of art at this point. They're art. Just like how we like paintings on a wall that a 2-year-old could do.
You know what would be cool?
Let's see it. Hear it.
All right.
There are taxidermist shows that are really cool to go to as well.
Show?
Like exhibitions.
No,
Not like a show, but like...
No, I know what you mean.
They bring their work.
Walk around and you see their work. Like, do I want to
And you can buy some too. You gotta look up some really good ones.
Oh my god!
Because when you look at them, you're like, "That thing's real," and you're gonna be like,
"No." I just left. It left.
Sorry,
No,
distracted
it's totally
you.
fine. But it was. I forget. That's okay.
It'll come back to you at the most random moment.
It will.
Okay. Back to euthanasia, and you'll think of it. Okay. Where am I at?
I'm probably gonna think of it like when I'm editing it in like 3 hours.
Just ask me when you think of it, because now I want to know what your question was.
I will. If you're watching or listening right now, just go read the description, and I will put the question and her answer that she sends me on Messenger. So just look in the description.
Okay. So things to consider when deciding quality of life. So I would put that little chart in there. I found a really good chart that you can look at. It's just like a general idea. Don't take it so literally because every pet is different and you know your pet yourself. But things to consider when deciding quality of life. Is the pet in pain? Is it not a healable pain? Can the pain be managed, and for so, how long? If not managed or cannot be managed long term, I would consider euthanasia. Next thing, this is like a, oh my goodness, is the pet eating? Is such an old like little myth. It's like as long as the pet's eating, it's okay to keep alive. It's not. It's not always okay to keep alive. Does the thing turn off? Is that okay?
Yo, the monitor's off. Yeah, it should still be recording. Is there a red light on the far right side?
Yes. Okay, I just want to make sure. Yeah. Okay.
Nah, the battery just died on the monitor.
I just want to make sure that nothing stops.
But
this is all very important.
This part especially. Just because a pet is eating does not mean its quality of life is good. An animal could be suffering, but still capable of being able to eat. I feel like this is such a big misconception, and I hate when people are like, this pet's fine, it's eating. And I'm like, your dog is literally skin and bones. It's eating because it's instinct. It's not because...
Mom, this is Zoe.
Oh.
I'm just saying.
Don't bring me into this. I don't want to be in the middle.
This is Zoe. She's blind. She's deaf.
Yeah.
17-year-old Yorkie.
Keep listening to these then and use that chart for your mom.
Yeah,
there you go.
Mom, look in the description. There's going to be a chart. Use it and calculate Zoe's score.
Just because it's eating does not mean it's okay. But is the pet eating? It's just like a general idea question. Is it eating as much as it used to?
Yeah, I feel like if it's not eating, it's a quick, obvious sign of like something's
obviously that. Yes.
Obviously wrong.
But
because
if it's
dogs love food.
Quantity, is it eating the same normal food that it used to, or if it's on like a specific diet, is it still eating that, or a specific food like diabetic food, renal food? Obviously if it's eating renal food, it's in renal failure or close to that. So,
Kylie is on a renal diet. What does that mean?
So
She's got liver or kidney?
Renal is liver and
liver
kidney.
disease, I think she has.
Yeah. So they're feeding that diet to slow down the progression. Eventually, it will fail. Sorry to give you those thoughts. Yeah.
No, it's okay.
So they're feeding a specific diet because of the calculations of the nutrients that are gonna not be like the protein's not as high.
Is it animal protein or
it's still animal protein, but it's lower quantity amounts because the protein can progress. The higher proteins can progress liver disease.
Yeah, I'm very. Whenever I watch her, I have to be like on top of like. There's clueless people who just give people treats
at the dog
park. And I'm so like, when I watch her, I'm like,
if you're giving treats, you should be giving hypoallergenic, sensitive skin.
Don't
treats.
give treats. Don't give treats to the dog
park.
Don't
give treats.
If it's not your dog, do not give it food.
Unless you ask the owner.
Mm-hmm.
But it's...
The amount of times I've had to, no!
Yeah.
Like, do not!
Yeah, it sucks. Especially if they have like allergies and again renal or kidney failure and those.
Oh, Kylie!
Don't think about it now. Think about it after. Keep drinking. Shot for Kylie.
Yeah. Shot for Kylie.
So, is it eating the normal food, and/or do you have to coax it to eat? Like, do you have to hand feed it? Is it not interested in eating otherwise? Because some pets will eat out of your hands because you're feeding it. You're offering it food, but it doesn't mean, obviously if it's not eating on its own, it's not really good. Does your pet have to get fluids? Is something to consider with that, because with certain diets.
What do you mean by fluids?
So we'll use Kylie as an example. Eventually, they may start giving her fluids under the skin as like the little bubble, to help keep her hydrated as her liver disease or kidney diseases progress, because they can't keep up with their intake of fluid. That's just the body can't process it.
The liver. Sorry, biology is not my strong suit. The liver, does that process fluids?
So that processes protein and works with like the bile acids and gallbladder. They all interconnect in one way or another. But
we're almost like jellyfish, where we have a bunch of organisms in us.
Yes.
I mean, it's not organisms,
the
but
mitochondria is the powerhouse of the cell. Exactly.
Yes. Sorry, I gotta pee so bad. So Kylie and the water bubble, I think, is where we were.
Water bubble, the fluids.
Yeah, fluids.
The subcutaneous fluids underneath the skin. Are they getting that for a certain reason? Because sometimes, the pet's just dehydrated and needs fluids. And how often? Is your pet going to the bathroom on itself? Do you have to stimulate the dog or cat? Is it going to the bathroom literally on itself? Is it aware that it's even going? Are you able to keep up with the maintenance and hygiene of that factor? Consider if no one is home, how long is the animal going to sit in their own waste? And is your pet developing urine scalding and or sores from feces? I see that a lot in the ER. A lot of burns to the skin from urine because of the ammonia. So
just like sitting in
their own urine. Yep.
Almost like a hot spot from pee.
Exactly.
Right? Like kind of.
Yeah, it's pretty much like that, but not.
Which is disgusting.
It's disgusting, and
Ugh.
Can your pet get up without assistance? Do you have a larger dog with a lot of stairs? Are you able to carry the dog on your own? Does your dog seem to not be interested in walking or going out or going and doing things that it used to enjoy? Is your pet having seizures, fainting spells, trouble breathing, or trouble standing? And then, is there more bad days than good days? Some pets have progressive diseases, and at old age, the issues that can increase the amount of bad days versus good days. But when the bad days start to amount or surpass the good days, consider quality of life. Even just like a discussion with your vet. Are they not enjoying the things they used to? A lack of wanting. So those are all the things I think about when considering quality of life, or consider going to talk to the vet about quality of life. Again, some quality of life appointments lead right to euthanasia, that same appointment. Some take a few weeks, some take a few months. It's just, weighing the pros and cons for your animal and for their health and their mental stability and what they are doing, and something you shouldn't be inconsiderate about or selfish about, honestly.
It's tough.
Yeah, here's a couple of progressive issues that can lead up to euthanasia. There's so many out there, but just a couple. Heart disease tends to be a big one. Cancer, internal organ failure, so renal disease, kidney disease, internal tumors that end up hemorrhaging. That's not a fun time. And neurological issues that progress.
Hemorrhaging, what does hemorrhaging mean? Like
bleeding out.
Bleeding?
Yeah,
okay.
Bleeding
internally?
Out. Yep. Obviously, those are things that can lead up to that situation, but there's also emergency euthanasias, which we're going to get a little into.
Actually, I think I had a story on that.
Let's hear it.
Yeah, question about. Oh well, no. Well, it was the question about like, do the drugs like have like a shelf life or whatever? But
Yes. Drugs do have shelf lives.
yeah, my elderly cat passed away Thursday night. I had made an appointment with an in-home euthanasia service. Excuse me, just yawning. For Friday afternoon, but it became clear around 8:30 that night before she needed. Became clear around 8:30 p.m. that night before that she needed the kindness ASAP. So like I've got it scheduled, but unfortunately,
Yeah. Should have scheduled a little sooner if that was, if that cat was in that type of.
okay. Yeah, so in this case, I rushed her to the nearest ER vet. And while the horrendous bedside manner is a whole separate conversation, I don't know what he means by that.
It means it wasn't handled.
It was a bad vet.
It doesn't even mean bad vet. It's just
bad experience.
Bad experience, and maybe wasn't happy how they were handled. Like maybe they had to sit and wait, or they were like the price tends to be a big.
Yeah, maybe if you could get into some of the nuances of like that emergency.
Yeah.
Because I can't imagine how hard that must be when
really
you're coming
hard.
in and it's like.
Yeah, so some of the more emergent situations that warrant euthanasia, and this is just a few, there's lots out there, but hit by car, where the internal bleeding, broken bones, in places that can't be fixed, like the spine, or it can't be amputated, stuff like that. Obviously, there's a lot of damage. Some pets can recover depending on the severity of it. Some pets die immediately, and some pets come in needing euthanasia, and obviously it's up to the owner to decide that.
You sent me a picture that I'll never forget.
Oh, I know what
I'll
you're
never
talking
forget.
about.
Yeah, you immediately know.
That was one of the bad ones.
That dog came in alive.
Yep.
So in that scenario, this is fitting this criteria of an emergency.
Euthanasia, where it's recommended that, that pet be euthanized. Obviously, it's the owner's decision.
I don't know if you want to give I don't want to speak on it because I don't liability or what. Like, I don't know if there's any liability on your end or not. But
I can't say specifics.
Yeah. It was bad.
It was bad.
This dog was alive. It was bad.
Yeah.
How the hell?
A lot of owners understand that.
How do you
when
deal
it's
with
bad
that?
and they come in and they say goodbye.
This dog was in
Yeah.
This dog, there was no coming back.
There's no coming back. Yeah. It's one of the, it's
That dog must have been in pain.
It was in a lot of pain, which is why as soon as it came in, they authorized treatment. For my ER, you can, as soon as you come in, there's an orange paper. You check yes to authorizing immediate emergency treatment and immediate catheterization, or you check off that you want CPR versus DNR. So do not resuscitate versus resuscitate, and you authorize, decisions pretty much.
When a dog like that comes in,
You'd be surprised. A lot of people do CPR.
but like, what if everyone's busy? Is that a dog where you're dropping what you're doing?
Exactly. Yep.
Yeah. Okay.
So there's codes which need immediate assistance, and then there's stuff that comes in that can wait. Obviously, a UTI can wait over a hit by car. In that situation, like I said, a lot of people choose CPR for even those pets that need euthanasia. And so they're doing CPR while the vet's talking to the owner and recommending best course of action and or euthanasia. And so that whole time we're pumping away. Every 2 minutes we switch people, and that way there's no fatigue. And that pet's getting the best optimal CPR given, and it's hooked up, it's intubated, it's giving manual breaths, getting meds, epinephrine to keep the heart going. It's getting everything possible while that vet is talking and that owner is deciding. So keep that in mind, that sometimes those conversations take 20, 30 minutes of us rotating out every 2 minutes, and that pet getting drugs every 2 to 5 to 10 minutes, depending on the drugs. But if they when they do CPR, they typically do authorized treatment, so that pet has pain meds on board. It's sedated usually, and that's why we're giving manual breaths, and or it's crashing and needs manual breaths. So that's not the greatest situation, but usually the owners know the situation. They come back and they don't want to. Sometimes they don't want to see the pet in that condition, and that's those type of situations in the emergency. That's totally fine because the pet's already usually out. It's a lot.
How do you? Sorry,
Okay.
I know I'm really drunk, so I'm going on weird.
It's okay.
How the hell do you wake up in the morning and go to work? No, seriously.
Same way I go to bed every night, and you see the amounts of alcohol I drink here. So
no, it's just this is.
We all have our own coping mechanisms. I tend to favor alcohol, not to the amount like where people should be concerned, but I have maybe like a glass or two of wine, or on bad days I'll do a couple shots, you know. Some people smoke weed, you know. He raised his hand for those who can't see.
If you can't tell by my voice. I can't breathe.
You know, a lot of vet techs have a lot of coping mechanisms. Thankfully, more we can handle it. Not like unhealthy amounts.
Because like this is
we
all
do
a
have,
lot for one dog for me.
Thankfully,
and you're doing this.
Yeah, often.
A lot, like consistently.
Yeah.
How does this not destroy you? How does this not wear you down?
So I look at it as I'm helping them. No matter what I'm doing, I'm helping an animal, whether it's helping it pass or helping it recover. Either way, I'm helping an animal, and that's what I want to do. I'm there for that animal. I'm there for that owner. I'm there physically, mentally, emotionally.
You have no idea how much volume that just spoke to me.
Yeah,
it means a lot.
It's hard, and like I said, we all cope in our own ways. We're very lucky that we have like grief counseling too from my hospital. Not every hospital has that, and a lot of vet techs will go to therapy. A lot of doctors will go to therapy. It's you gotta be strong.
No,
because if you're not, there's a reason why there's a suicide prevention group for vet techs and vets called Not One More Vet, where it supports us and a lot of people who are struggling because of what we have to deal with every day. Owners who aren't angry with the outcome or the cost, or us struggling with losing certain pets, and
when it is time for me to put Bailey down, that's gonna be an entire day, an entire week, an entire month, an entire year of process.
I don't think we ever really stop processing.
You have to do that, and then go take lunch, and then go help another.
If I have time
another
for
12
lunch.
dogs.
What is a lunch?
No, but like, oh my God.
Yeah, it's not for the weak. You get compassion fatigue very easily, and that's why we have high turnover rates is people get in thinking they're going to be helping, and they are helping, but they don't realize the cost of their own mental health and having to experience death daily. You know, even if it's just, if you're even at a general practice hospital, not even an ER, you're still experiencing it maybe once a day or once every couple days. Putting it down a pet that's been going there for years, you know, or a pet that even people bring sick and dying animals to general practice. And as much as I'm like, I understand because the pet's grown up there, you need to take it to the emergency room. Just like how you wouldn't bring yourself with a broken leg to your general practice hospital. They're just be like, go to an orthopedist. Yeah, we can't. Like, what are you doing here? Yeah. Like, we can't even give you meds. Like, here's some Tylenol, extra strength.
Yeah.
So that's just something to consider. Even though you want to keep going, unless you plan on euthanizing, or it's a something that not crazy, like a hit by a car. You're not gonna bring a hit by a car to your general practice. If you do, don't. And that's just like one of the things. I have a list here of things that weren't immediate, you know, not even immediate, but emergency euthanasias. Another one, hemoabdomen/thorax. When there's blood in the abdomen or thorax, we call it hemoabs or hemothorax, due to internal hemorrhaging. And that could be due to a couple different issues. So tumors, rupturing, blood, cancer in the blood, heart perforation, and there's like so many other things that can cause that. And that requires diagnostic workups. And if you can't afford that, obviously, euthanasia is the most humane thing you can do for that animal instead of making it suffer. And it doesn't always have to be immediate for certain situations. You can drain those sometimes. But if it's like cancer of the blood, it's not going to get better. If you have a ruptured tumor and it's like metastasized to something, that's not going to get better.
Is it better to be preemptive in that situation? Or is there a certain degree that you can kind of wait?
I think a certain degree for certain situations. So if we call it a flash ultrasound, where we just where regular vets take, not even ER vets, they're not specialists. They take an ultrasound and they take a look and they see and give their best estimate of what's going on, guesstimate, I'll say. And from there, they recommend an ultrasound specialist who can tell you specifically what's going on. Or if it's so bad, they recommend euthanasia, then you know that typically that's not the greatest thing to wait on.
You can't like really come back.
Exactly.
Yeah.
Seizures. Some pets do not come back from seizures, especially long-lasting ones. There's brain damage.
Well, you might not. I don't want to say you might not at the end. I'm not saying that because I am doubting your knowledge.
That's okay.
I'm just saying that in the sense of like, I don't know. We don't know everything. What is the seizure? What exactly is the seizure?
So, I don't truly understand them myself, I would say. It's obviously a misfire of neurons and stuff in the brain that's causing the body to malfunction. Some are, grand mal, multiple long-term. There's clusters of multiple short-term.
Are you aware?
I don't think so. I'm not 100% sure.
Anesthesia? Do you think you...
So I know a lot of people, when they come out of them, people-wise, they're exhausted and drained because it takes a lot out of them. But I've never asked if they're conscious or aware. I believe some maybe, and some you don't. I think it depends on like the severity of the seizure, because there's certain seizures where you just kind of focus out, and you don't even know what's happening, and it's just happening in your brain, and you're just like, so say I'm just sitting here staring off and I'm having seizures, and no one would know until, you know, obviously the effects start to catch up. I believe like heart palpitations can be an indicator of some seizures to the certain degrees.
It's not
'Cause it's the
necessarily
neurons.
painful, but if it's sort of like,
You don't feel great.
you're like, whoa.
Yeah.
You know, you freak out.
Because you obviously tense up. A lot of animals will lose their bowels. They'll go to the bathroom. You got to worry about them biting their tongue, but you obviously can't stick your hand in there because they don't realize, I don't think, 100% what's going on. Obviously, the longer the seizure, the more potential brain damage there could be. So I think vets will give you the outlook versus recovery versus euthanasia in those type of situations, especially if it's a long, really bad one and they don't come out of it. Pets will even die in seizures because they don't breathe. Certain types of seizures, because there's a lot of different types. Obviously, neurology and medications will help that, and don't stop the medications if your pet's not having seizures, because that means the medication is working.
Yeah,
I get that so often.
I have an interesting seizures thing, but I want to talk to you outside of this about it.
That's fine.
So I'll talk to you after.
All right.
But yeah.
A lot of people stop giving the seizure meds because they're like, oh, they haven't had it in a few years. And then all of a sudden it has one. She's like, I stopped the meds because you wasn't having one. But it's because the seizure meds were working. Another thing, though.
Do you know what the seizure meds do?
It's like an anticonvulsant, almost.
Okay.
Again, different types of seizures require different types of medication. So phenobarbital, potassium bromide are a couple of them.
Crazy how we figure this crap out.
It takes a lot of knowledge, and I'm like, I'm just a fraction of my knowledge.
As much as I love to say humans are awful, if it wasn't for humans, right? Like as
we'd
awful,
be dying at 30 years old,
I know,
if that.
I know.
20
Like,
back in the olden days.
As much as awful crap as I see humans do to dogs,
Yeah.
if it wasn't for humans, dogs wouldn't have as good of a life as they
We wouldn't have
do.
even
yeah,
us.
we wouldn't. Yeah,
We'd
exactly.
be, like back in the olden days, we'd die at 20, 30 years old if we were lucky. Pop out some kids at 12,
I know. Yeah. Oh.
It's crazy. Another thing to think about is poisoning. Obviously, acute damage or long-term damage or irreversible versus depending on the degree of the poisoning. So rodent poison, big one. It blocks the nutrient potassium, or not potassium, vitamin K. Vitamin K helps your body create clotting factors. And if you can't produce that, that's why when people are on blood thinners, they take out, I keep wanting to say potassium, but vitamin K. And then when their blood is thin, they give them vitamin K. So vitamin K causes your blood to clot. If you're untreated, you bleed out internally, especially if you get any nick bruise. You bleed through your eyes, through your nose, through any orifice open. It's not a fun time. Ears, mouth.
Yeah.
Yeah, it's not a fun time. There's also unintentional, obviously, like there's mold. Your pet gets in the trash. Mycoplasma, which I'm always worried about because that one time Charlotte got in the trash and ate Thanksgiving leftovers from weeks ago because I suck at taking my trash out occasionally. I took them immediately in to make them vomit, and it wasn't moldy because the food was so processed, but I was still scared. Mycoplasma can cause seizures and failure of organs and stuff like that. So that's why it's super important whenever your dog gets into the trash, especially eats old food that's been in there for a little bit and potentially be moldy, that can kill a dog. And people don't realize that.
I would never have thought that.
No.
Ever.
No, it's just trash bins are killers if not changed often.
I'm happy we've got a child lock on ours because it's like
I have a child lock on mine now too.
I'm not. I have 2 border collies. They know how to open the damn trash, and it's like there's no. It's a pull-out trash bin, and it's only got a little like nub.
A nub. Have they ever figured that out?
They know how to. They know how to open it. So yeah,
it's scary. And
well, I'm happy. Wow, I would never have thought of that.
Yeah. So when I get home from the ER and find that my dog's in the gone to the trash, and I drive right back to the ER that I came from, I'm like, here to make my dog vomit. And another one is obviously dog fights or animal fights, animal on animal damage to each other. You've seen a couple of those photos as well from the ER. Intestines hanging out, shredded. It's obviously, the internal damage is higher than 90% of a chance for it to survive. Like, there's some damage that you can't get back. Like, I think I sent you a video of a dog with its neck torn right open, and you can see its jugular vein. That dog survived, but it took months on months of very expensive treatment and care. That dog was hospitalized for half that time too, and hospitalization at a hospital is expensive on its own. I think it's like $2,000 a day, and I don't even want to think about that because that makes me sick to my stomach. But sometimes some of that damage is irreversible, and you gotta say goodbye.
Just sort of accept.
A lot of times those animals...
Accept the terms and conditions for what they are.
Yeah. A lot of times emergency euthanasias, those animals are already hooked up to oxygen. They're not awake. They're on their way out almost. It's more of a chance for you to say goodbye, and then for us to help the pet pass more comfortably almost.
Wow, we're weird when I think about that, where we almost like in the wild, if I was a wild cheetah and I had cheetah babies, and my cheetah babies died, I wouldn't necessarily grieve them.
No, because you're an animal.
Sorry, my cat's going nuts right now. Okay, Tucker. But we're so different.
We're on a different level of how we process stuff. So depending on the situation of the emergency, some situations you're allowed to say goodbye. Sometimes your pet dies while they're trying to save it. That happens.
To think that
and you don't even get to say goodbye.
Delay it like that just to say goodbye.
Yeah. If you bring your pet to the emergency for that bad of a situation, be ready, this may be the last time because your pet may die while they're trying to save it, or while they're trying to do CPR while the doctor's still talking to you. They obviously will let you see, they go home and we try to save it, but they're prepared for the situation if the pet was to crash. And it's just overall, something to consider is not to keep an animal alive for yourself.
That's
easier
hard.
said than done. It's very easier said than done. You want to keep that animal alive because you love that animal. You don't want to let go of them. I don't want to let go of any of my dogs. I know I'm going to have the same issues.
I think as much as dogs are requiring routine and thrive on routine, so do we.
We do.
And the thought of that routine
being disrupted can mess things up. But we also have to keep in consideration that animal could potentially be suffering. Mm-hmm. And we need to take that suffering over our own selfishness and put them on a pedestal.
Pretty much everybody I know that I've talked to is like, oh, if I'm like that when I'm old, just kill me. You know what I mean?
Yeah.
And yet here we are.
Struggling.
Trying to delay all this inevitable.
And I think a lot of people just hold on to the memories of that animal before that animal even passes. Like, they want to keep that animal alive because of the memories that they've had together. They're pretty much like blinded almost for their love for their animal. And that's why, like, having a consult or even having family members give you their opinion from outside the perspective, or friends, they can really, like, wake you up, because they'll be like, you know, tell you the situation, and you look back at your dog and you're like, oh shit, I'm doing this to my animal and it's ready to go.
Yeah, you might think you're doing the best you can, and then
you realize the best you can is actually euthanasia.
Yeah.
And I think it's so very hard to come to that realization and to do that for us. And
to know you're right. To feel confident.
That you're right.
I don't feel like you're ever going to feel confident.
You're not. Because a lot of times when people want their pet to die at home, they don't want to take away that opportunity for that animal to be like, they don't want to take away its life because they think they don't want to cut their life short. Mm-hmm. But keeping in mind that if that animal is suffering, you're not keeping, like, the life isn't shortened. The life is prolonged, and it's suffering now. And I've struggled with this because my significant other had a rabbit, and he did not want to euthanize him, but that rabbit was ready for almost a year before he put him down. And it was an issue. I told him I wasn't going to get involved with it anymore because I wasn't comfortable with the rabbit still being alive at this point, because its feet the feet were so raw. The thing was ancient. He had eye issues, and none of, like, I don't know if it's just like his family lifestyle, but none of them wanted to let go of this rabbit. And I'm like, I understand you don't want to cut his life short, but he's suffering. And if you're not going to take my opinion for it, I'm not going to, be a part of it, because it's hurting me seeing this. And eventually the rabbit passed on his own, and I wasn't comfortable still with this. And it's just, it didn't sit right with me, because that rabbit literally suffered until his death. And I think that speaks volumes to people when they realize it.
Yeah, because everybody wants to pass in their sleep peacefully. Nobody wants to die.
Exactly. And
impaled by a spike.
I know. No one. Like, it just sucks because I'm like, that's not the case. Not everyone passes in their sleep. Even when they're passing in their sleep, they're still going through something. Mm-hmm. They're still feeling a little of something. You're taking away that opportunity where they don't have to feel pain. And like I mentioned before, they don't think of the future. So they're feeling the present. They're feeling that they hurt yesterday, so they're not going to want to walk today. And then today comes, and they're feeling today, and they're still thinking about yesterday and today. And if I keep walking, I'm going to be hurting. They don't want to do it. And I think, as much as we love an animal, I think we need to start thinking of them before they start to struggle, before they start to suffer. I think humane euthanasia is always the best option for when it's necessary. Looking at that chart, weigh the pros and cons. Looking at the chart, think of the good and bad days. Don't just be like, if it's eating, it's fine. Look at all those other things on that chart.
And yet, as simple as that is, it's so hard.
It's so hard.
I know
it's hard.
Thinking it through my head, not even of my dog, but I'm thinking of, like, because I know you're listening, Boston and Boston's mom. Like, I can just picture her. This is such a tough.
It's so tough.
It's such a tough decision and
it's extremely tough. And I've almost gone numb. Ugh. I don't want to say I'm numb to it, but I want to say I'm used to it at this point. Where at this point I'm okay when I see the signs and I'm like, okay, I'm ready. When I put down my first dog, it was a family dog, but it was my dog. And I think I was probably 12, and I'm like, Mom, it's time. I saw the facts when I was that young, that I knew she was ready to go. And my mom respected that, and we did an in-home euthanasia. And then our next family dog, King, big, massive mastiff.
Was the first one the Doberman?
Yes, Sheila. Princess Sheila. King, he, you know, what sucks is he was all there mentally until the very end. However, he had a nasal tumor and could not breathe. So to confirm it was a tumor, or if there was something else going on that we could treat or try to fix, we did an MRI, and that confirmed the nasal tumor. And him being 13, 14 at this point, for a mastiff that's 170, 60 pounds, it's just not logical. So while his mind was still intact and his breathing, you know, has declined, we decided to take him home for one more day with us and then go back for euthanasia the next day.
Theoretically, he could have lived 2, 3, 4.
Potentially.
Right, but...
Potentially, but he couldn't breathe.
Yeah, so do you...
Dogs breathe through their nose naturally. So from birth, they're breathing through their nose. You don't see a dog walking around breathing through his mouth 24/7. They pant when they're, you know, very, like, out of breath from, you know, exercise, play.
Just like us.
But naturally, when they're at rest, they do not breathe through their mouth. So therefore, he was trouble breathing because they're not going to naturally just start panting unless exercise. So sleeping, we were worried about him suffocating to death. The tumor grew over the course of like 2 months, and we thought maybe antibiotics, maybe he has a respiratory infection. We, you know, did diagnostics, we did x-rays. It got up to the point where we did MRIs, which are like $3,000, and it's very expensive, but we wanted to get down. This was more like, if we got to figure out what's going on, or his quality of life is not comparable at this point to keep him alive. And obviously, I personally had to know what was going on with him before I made that decision, because if it wasn't something that was treatable, or it was something that was treatable, why would I put him to sleep? And then at his age, at his size, and the size of the tumor at this point, and where it's located, you know, surgery wasn't an option. And instead of, you know, just being like, euthanize him there, I took him home. We had one more good day together, and we took him back. And
that's that's what I'm fearing, though. It's that last day.
It's always the
especially
last day.
Knowing it's the last.
I almost prefer last day, because you get a chance to grieve over it. You get that last day to give them something a little special.
No, I want the last day, but
yeah.
That's gonna be.
It's hard.
Like,
euthanasia itself is horrible.
I can't imagine. No. What's going to be the worst is the drive to the vet.
Oh yeah, it is, and the drive home without anything in your car.
No, that's not. I haven't even gotten that far yet. I haven't even gotten that far yet. I'm still stuck at
driving to the vet.
At like when people go and like, oh, we went and we did all these, like, knowing this is my last time bringing you to Stoddards, or I can't get past that point right now.
That's why I kind of like in-home euthanasias, because they come to you, and you don't have to make that drive.
Mm-hmm.
They come to you. Your pet's comfortable. Some will even do like locations like parks and stuff like that. So their last memories is at the park, you know, having a good day, you know, give them that last good memory, you know.
Yeah, that's probably what I'd want, is for her to.
It doesn't even have to be Stars. It could be any place that she loves.
Like her favorite place or her favorite thing. Like, because as a human, it's always like, oh, well, shit. If I'm going to die, I might as well die doing something I love. You know what I mean? Well, same with her, right? Like,
exactly.
Go
Go do that thing one more time.
Go find a huge field full of sheep. Here you go. Wow.
I know. It's hard things to talk about. And
You're giving me too much to think about.
you wanted this topic. And you got the topic.
This is a lot.
It's a lot to process.
Because I've never done this. I don't have any. Like I said, it was,
a lot of
hey,
people
we
don't.
already put her to sleep. Sorry. So,
Right.
like, this is...
It's a lot to process. And there are grief counseling groups, too.
There's a lot of things with dogs
humans.
I've done and I've learned and I've known. And this is something that is so in the future that...
Oh, I feel you. There are grief counseling groups for people who put down their pets. A lot of places will offer it. It's something to consider, especially if you're struggling. I find, going there and just listening to other people's memories and you sharing your own memory and your struggles. It doesn't even have to be about your pet. Just going there and listening, or going there and just talking about your day, what's changed in your day, can really help people a lot. I know people are going to be like, it's just an animal. But, to you.
Not all of us.
I know, not all of us. To the owner, the actual owner, it's not just an animal. To the person who's suffering, it's not just an animal. That was their best friend. That was their only friend. That was, their soulmate, their heart dog. That was their heart animal. That animal was there for them when they went through all this traumatic experience over their life. It's been there, half their life. Some of these animals live to 20 and you're only like 26. Like,
yeah,
it's a lot to go through and it's a lot to process. And I think we're very lucky that we have grief groups that offer that support, that understand if you're going through something like that there's other people who understand it and you don't have to go to someone and they're going to be like, it's just a dog. It's just a cat. It's just a bird. Like there's other people who get it and understand it and are willing to be there for you because of it.
Crazy how much of an impact
Animals
that
change our
creature
lives.
can just...
They change our lives and it's for the better, I feel. If you take advantage and make their lives the best, they return it and make your lives the best.
Yeah. All right, you've left me with too much to think about, so... Woo!
I know, it's a lot.
That's heavy.
Hopefully something lighter next week, maybe.
Very heavy, yeah. Damn, do you have any last mind blowers?
Not off the top of my head, but I'm sure
All right.
we'll think of things. And if anyone has questions, concerns, obviously we're always here to answer them. And otherwise, we'll see you next week.
All right. Well, thank you and good night.
Good night.